Matters of privilege and recognition of guests, the Honourable Premier.
Well, thank you very much, Mr. Speaker, and good morning, and welcome back to all of our legislative colleagues for the final day of debate for this week, at least in the formal state, Mr. Speaker, in this Legislative Assembly, and to all those who are tuned in at home. I would like to begin, Mr. Speaker, by saying tonight I have the great privilege in participating in what is the 20th Simons Lecture and presentation of the Simons Medal at the Confederation Centre of the Arts, Mr. Speaker. And the medal is being presented this year to Madame Louise Arbour, Mr. Speaker, a truly fascinating and incredible Canadian, Mr. Speaker. And I look forward to her presentation tonight. The Confederation Centre of the Arts, as we all know, was Canada's gift to the province, Mr. Speaker, in recognition for the role we played in the foundation of this country. But I think ever since then it's been our gift to the rest of the country and the world, Mr. Speaker, in the provision of arts and culture events and such as this, Mr. Speaker, like the Simons Lecture and Medal, of course, named in honour of the late Tom Simons, a great Canadian and a great friend of Prince Edward Island and a great supporter of the Confederation Centre of the Arts. And 20 years ago, Tom and others designed this process, Mr. Speaker, which invites distinguished Canadians to thoughtfully reflect on what it means to be part of this diverse and ever-changing country, Mr. Speaker. And I look forward to Louise Arbour's views tonight, Mr. Speaker, her perspective on the country, where we stand, and her views on immigration, the pandemic, and the law, and other aspects, Mr. Speaker. It should be a wonderful night. Mr. Speaker, yesterday afternoon on our regular meeting of premiers as part of the Council of the Federation, our chair, Premier John Horgan of British Columbia, revealed to us that he was undergoing some surgery today. And Mr. Speaker, it was, while it was sad and disappointing to hear, Mr. Speaker, Premier Horgan was in good spirits. He has a very positive outlook. And on behalf of all Islanders, I certainly offered him our best wishes and thoughts on a speedy recovery. One of the great things you get to do in this job is meet wonderful people like John. He's an outstanding and kind person. We talk all the time about the fact that it's an Islander, Dr. Bonnie Henry, who's leading the charge in British Columbia, and we laugh about that all the time, Mr. Speaker, and I look forward to getting a call later today with some good news and John, and wish him a quick, speedy recovery. And finally, Mr. Speaker, this weekend is Halloween. It's an exciting day for lots of young Islanders. I remember myself how much fun Halloween used to be. My kids are getting to the age where they're not as anxious to get dressed up and go out, Mr. Speaker, but I know many in this House and many across PEI are looking forward to participating in Halloween. I wish all of those who do participate a bountiful harvest, Mr. Speaker. I want everyone to be safe, and all of those who are out driving through communities to be extra safe, to be extra careful. It's an exciting day for particularly the young people in our province, and let's just take our time and keep our communities safe and make sure our kids have a wonderful, exciting Halloween. So thank you very much, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Thank you very much. I too would like to welcome everybody back to the legislature, and also to start by saying, yeah, let's have a great and safe Halloween when the night comes on Sunday. And I know the weather is not looking like it's going to be terribly great for the kids, but I'm sure that's not going to stop them going out. One of the lovely things that I've seen sprouting up, particularly around the capital region, is the expansion of the active transportation infrastructure. If you take the bypass, you'll see it there. Maypoint Road now has something, and I've spent, as I'm sure many in this House have, a fair amount of time in Cornwall, where all the way from downtown Cornwall into the city centre now is there's an active transportation lane, much of it a dedicated separate lane, and that's a wonderful thing. And I really hope, and I see how much that is used, and I think that's an enormously important part of our goal to reduce our GHGs, and transportation is our #1 thing. So I just wanted to this morning talk a little bit about bike-friendly communities, which was previously bike-friendly Charlottetown, and they have been a real active booster and advocate for expanding our active transportation system here on Prince Edward Island, and they recently launched an outreach and advocacy campaign, and that's been done in partnership with the PEI Transportation Fund. And bike-friendly communities they're going to work to address the barriers that may exist for those who are perhaps reluctant to get back on a bike again and are not used to that form of transportation as being a possibility for them to, for example, get to work or go to the grocery store or whatever. And they want to hear from experienced cyclists who do this every day, and there are many of them, but also from those people who perhaps haven't ridden a bike since they were kids. So I really appreciate the work that Bike Friendly Communities is doing here on our island, and there will be public meetings and guided rides on the existing infrastructure. And that's all part of this plan, next phase of the project. So thank you to them for that. The Canoe Cove Community Association is holding their AGM on Monday, and they operate what is really the hub of the community in Canoe Cove, which is the old schoolhouse, their beautiful little building. And it was made famous in a painting by Robert Harris back in 1880, but perhaps more famous for its rhubarb socials and for all of the community events that they host there. And the Women's Institute has, I think, recently started yoga classes. So I commend a very strong little community in my district, Canoe Cove, for the work that they've done to maintain and restore that building and use it as the community strengthening hub that it is. And finally, like the Premier, I will be going to the Simons Lecture later today, and I'm really looking forward to hearing Louise Arbour. When I think back to the last few Simons Lectures, the current Prime Minister, Justin Trudeau, and Bob Rae spoke, and last year, Senator Murray Sinclair gave a really spectacular address to those who were fortunate enough to be present. And of course, that preceded much of the discussions that we've had more recently on truth and reconciliation, but because of the discoveries that were made following that. But these Simons Lectures really are an opportunity for all of us to learn more about our country, the history of our country, and perhaps where our country is going. So, like the Premier, I'm looking forward to hearing Louise Arbour's thoughts tonight, and I hope everybody has a great weekend. Thank you, Mr. Speaker.
The Honourable Leader of the Third Party.
Well, thank you, Mr. Speaker, and it's always a pleasure to rise in this legislature and welcome everyone back. And I'd just like to allude to some comments you made yesterday on your birthday about getting older, and you didn't mind getting older, but you had a little bit of an issue with your hair, and but you're okay with that too. But I do have an issue with my hair. Like, you know, I hope not to get as bald as I am, but I don't mind getting older. Thank you, Mr. Speaker. On my drive in this morning, I saw the price of gas went down after weeks of increases, and I'm sure it's welcome news to many islanders, as it is to me. Mr. Speaker, I'd like to recognize Ted Grant for his almost 2 decades involved with the Mikin Children of Hope, which he and his wife co-founded in 2003. Ted was diagnosed with a terminal lung disease 5 years ago, causing him to step back from some of the organization's activities, but his dedication to helping others remained. When he heard from his doctor that he was at a critical stage, Ted and his family decided they would dedicate their efforts towards making up the fundraising gaps caused by COVID-19. Over the years, as president of the organization, Ted has visited Kenya more than 20 times, and the organization raised more than $2 million under his leadership. Ted's dedication to improving the lives of others is truly inspiring, and I would like to thank him and his family for all they've done for this great organization. And Mr. Speaker, as was mentioned earlier, as youth, we all enjoyed Halloween. I still do, and my wife, and we get dressed up. And when the youth come to our door, we have a lot of fun. And we're looking forward to Halloween this weekend, and there's lots of activities going on across the province. The weather doesn't seem like it's going to be good, so as they're saying, you know, dress in bright colors so you're seen, and I encourage everyone that's driving to be very careful as well. Thank you, Mr. Speaker.
The Honourable Member from Charlottetown West Royalty, Third Party House Leader.
Thank you, Mr. Speaker. Just saying hello to everybody in Charlottetown West Royalty, and I want to send a special greetings today to one of the greatest PEI sports teams of all time. And in the 2019-20 season, the UPI women's basketball team, they had a run like no other. They captured the A-West title against a very competitive field, and then they moved on and narrowly missed the gold medal game in our whole entire nation. They're led by Jenna May Ellsworth, who was the most valuable player, defensive player, and first-team All-Star that year. And this is the first banner that they're raising since 1997-98. COVID disrupted that last year. There was no play last year, and so tonight Saturday night, they'll be raising the banner at the UPI Fieldhouse to mark the AOS Championship. So I'm encouraging all Islanders to get out at 6 o'clock and see this special team in action play, and the men play at 8 as well. But this is truly a remarkable sport feat for Prince Edward Island. So good luck with your season today, and we'll be cheering you on as an island. Thank you, Mr. Speaker.
The honourable member from Charlottetown, Winslow.
Thank you, Mr. Speaker. It's a pleasure to rise, and of course, a lot of people will be tuning in tonight to see Jay Scotland to see if it will be a wet Halloween or a dry Halloween. Hopefully not too many Inspector Gadget or Mary Poppins costumes on Sunday with, of course, the umbrella. And I had a chance this week, Mr. Speaker, to have a chat with Susan Freeman at Meetings and Conventions PEI, so it was great to get an update on their plans as the world does start to open up. So I just wanted to say a quick thank you to Susan. Thank you, Mr. Speaker.
The honourable member from Mermaid Stratford and the opposition House Leader.
Thank you, Mr. Speaker. It's a pleasure to rise. Hello to everybody from Mermaid Stratford. I find it encouraging. I've talked to a lot of constituents who have said they've started watching the legislature by TV a lot more since COVID happened. So hi to all those new viewers over the last year. Mr. Speaker, I would just like to recognize that it is Breast Cancer Awareness Month, and I want to send out just a shout out to all the survivors and all those that are battling breast cancer. My mom's a survivor, and I look up to her every day. And so anyway, I know it's an important month for them, and you've been in my thoughts all month. Mr. Speaker, I spoke to Mary Lou Mamie. So she's a resident of District 13, but she's been a business operator in District 5 for the last 9 years, and she operates Stratford's own barbershop. Super busy barbershop. So busy, in fact, that Mary Lou recently followed her dreams, and she has expanded. And so she came out of COVID, and she has now opened what's called Stratford's own hair oasis, but she found that a little hard to fit on the sign, so it's called Soho Spa, and it's located at the new location at 175 Shakespeare Drive. So this is a new commercial space built by Harborside Engineering and Reactive Health, and we've got lots of small businesses moving into that building, which is great to see. She had her grand opening on Wednesday. 200 people showed up. It was phenomenal to see that level of support. Anybody who drive by, you would have seen the lineup out the door. It was spectacular. She was just so humbled by how much support she saw by the community. It's important to note she has grown her business from 5 employees to 15 employees. That's huge coming out of COVID. And I just wanted to say hi to her and just say, like, there's the new spa. It's the first men's barbershop Aveda operation in Atlantic Canada. But even more so than that, it's the first Aveda business that you'll see that has women's hair, men's hair, and a spa under the same roof. You'd be hard-pressed to find another one in Canada. I think that's pretty spectacular, and love to see her there opening up in Stratford. And I'd also just like to say she's got 4 spots for manis, 4 spots for pedis. And she said the fastest growing part of the beauty industry is for men. So, Mr. Speaker, she reached out to me and she said, what a lot of men don't realize is foot care is one of the most important things that you can actually do for your health. And she also shared with me that it tends to be that men aren't as flexible. So taking care of your own feet is not as easy as some women taking care of theirs, but she said it's of the utmost importance. So she's inviting all of the members of the House to come on out and see her and take advantage of the Soho Spa in Stratford. Thank you, Mr. Speaker.
Oh, quite an invitation. The honourable member from Charlottetown, Victoria Park.
Mr. Speaker, and good morning to my colleagues and to all those watching from Charlottetown, Victoria Park, and all over the island. Mr. Speaker, I'd like to welcome Senator Kim Pate to Charlottetown. She's here today, right now, talking to the PEI Working Group for Livable Income, talking basic income guarantee for PEI, which is pretty exciting. So welcome to Senator Kim Pate. As was already mentioned in here, Halloween is a couple of days away, and we've been excited about Halloween in our house for quite some time. We've been decorated all month, and so we are more than ready, and the rain won't rain on our parade, that is for darn sure. And we are really looking forward to this year, as we did last year. Stephen Fudge puts on a vintage circus in his home, or I shouldn't say in his home, outside his home at 12 Upper Hillsborough, and he has all the fences set up. It's very COVID friendly. You go through the circus, you get a guided tour, everyone's in costume, and it's really, really fun. So we're looking forward to that this year. I'm not sure if he is still looking for jugglers and people spinning plates and unicycles. It's quite something. It sounds like he's upped his game from even last year, and last year was quite spectacular. So I haven't picked my costume yet. I have a huge tickle trunk, not concerned about that. But anyway, happy Halloween and have a great weekend, everybody. Thank you, Mr. Speaker.
The Honourable Minister of Education and Lifelong Learning, Minister responsible for the status of women.
Thank you, Mr. Speaker. It's a pleasure to rise on this Friday morning, and welcome back to all my colleagues. And I'm really pleased to hear what Soho Spa offers from the member from Mermaid Stratford, because now I know what I'll be getting my husband for Christmas. So thanks for taking care of that for me. I appreciate it. Mr. Speaker, for those who might not be aware, but the PEI Business Women's Association is hosting a conversation corner this morning on the financial literacy and gender gap, Mr. Speaker. So I'm sure that's going to be a very interesting conversation corner, and I hope everybody enjoys it who's participating today. Also, Mr. Speaker, Trade Horizons, it's a program that's offered by the Women's Network. They're currently accepting applications for their January program, Mr. Speaker, and I'd encourage anyone who's interested or would like to know more about this incredible program to check out the Women's Network website online. And Mr. Speaker, this morning, my goodness, my heart, I don't think it could be more full. I had a little ninja leaving the house and a little pirate, and they were just laughing and giggling and so excited about the day to come, Mr. Speaker. So I want to take this opportunity to really thank all of our education staff and all of our early learning and childcare educators who have worked so hard to ensure that today is a really fun day for all our little islanders, Mr. Speaker. I know the kids will be exhausted in the best possible way when they get home today, Mr. Speaker, and it is really an exciting weekend, but certainly I know safety has been talked about here in this house, Mr. Speaker. I just want everybody to have an enjoyable, a fun, a wonderful weekend, but ensure that safety is at the top of mind for all, Mr. Speaker, and I am looking forward to meeting residents of District 9 out in the neighborhood and seeing all the little islanders dressed up in their cute attire. Thank you very much, Mr. Speaker.
The Honourable Minister of Social Development and Housing.
Thanks, Mr. Speaker. It's a pleasure to rise today. Welcome everyone watching from District 18 Rustico Emerald, especially Karen George from the Line Road. I know she watches a lot and she always has some good input into the political thoughts of the day, and so I want to thank her for taking the time to give me a call and let me know her views and opinion, because that's the way you're able to represent, Mr. Speaker. So, Mr. Speaker, I also wanted to welcome Senator Kim Pate to the island, of course, an advocate for basic income guarantee, and meeting across the street with the PEI Working Group for Livable Income as we speak right now. I'm hoping, Mr. Speaker, I might sneak out of the chambers and go and have a brief conversation with her today as well. Of course, basic income guarantee is something that I've thought holds great promise for a long time, and I'd be an advocate for a pilot of that. And Mr. Speaker, I know it's not all the way where we want to go, but we do have a targeted basic income right now for some of our very most vulnerable islanders, and to me that's a very small step towards what we can do, and I look forward to making more progress in the future. Thank you, Mr. Speaker.
The Honourable Minister of Finance, Deputy Premier.
Thank you, Mr. Speaker. Pleasure to rise today. Happy Friday to everyone. Happy Friday to everyone in District 4 who's watching and listening online. It's a beautiful fall day. The silage hasn't been cut yet on our fields, Honourable Member, so I'd hope that we have some good weather moving forward and we get the silage off. I had the pleasure last night of attending a reception and meeting the Honourable Louise Arbour, and what a fantastic and exciting Simon's lecture it's going to be this evening. When you read her Wikipedia, it's very humbling to see someone with such credentials come to the island to accept the award. And I told her what a privilege for her as well, because I think it really defines and signifies Canadians that do make a difference for the country and for our province. And Mr. Speaker, finally, there's a new business opening in Murray River. Well, it's already open, but the grand opening is tomorrow. It's called Mill Plus Birch, and they have ladies' apparel, jewelry, home goods, and gifts. And 90% of the stock that's in the shop is created by either managed or owned companies that are women. And so I'm looking forward to attending the grand opening tomorrow. I was just on the Facebook page. Looks like they have some lovely clothing and gift items. So I encourage everyone to take a little road trip to Murray River sometime in the near future and check out Mill Plus Birch. And I just wish everyone a great day and a happy weekend. Thank you.
The honourable member from Summerside South Drive.
Mr. Speaker, and I thought I'd just rise today and recognize some good work that's been going on by a little gem at the heart of District 22. There's a used bookshop called Seaside Bookshops. And Nancy Quinn has recently received national attention for being featured in Chatelaine magazine. Her Twitter supporters reached out, and she didn't even know that this was going on until the magazine reached out to her. So now, not only the bookshop, but Summerside itself is featured in a national magazine. And further to that, that same bookshop was honoured by the Writers' Trust of Canada, who it was founded 40 years ago by the likes of Margaret Atwood, Pierre Burton, Graham Gibson, Margaret Lawrence, and David Young. So she is one of the recipients of the 2021 Writers' Trust Awards as well. And this was all garnered her national attention. But for Nancy, it's all about the community and coming into the bookshop. So despite all of this attention, she is not being pressured into going to online sales to try to capitalize on this. She wants to keep that community spirit alive. She wants you to come to her bookshop, and she wants to guide you towards that book that you're going to bring home. So I really applaud her integrity, and she's just really at the heart of a lot of what goes on in Summerside. When tourists stop by, they stop into her shop, and she'll direct them to go to Holman's Ice Cream Parlor. She'll direct them to go down to the boardwalk and have a nice walk. She'll direct them to go to the local brewery, all sorts of places that she goes. So she's a real ambassador for Summerside, and I applaud her work. Thank you, Mr. Speaker.
Did I miss anyone? I don't think. Member statement. The Honourable Leader of the Third Party.
Thank you, Mr. Speaker. Mr. Speaker, throughout the first 2 weeks of this sitting, we've heard countless issues about the state of healthcare in PEI. The issues are widespread and not concentrated on one area of healthcare. It could be primary care access, mental health and addiction services, or long-term care. We have a patient registry of more than 20,000 Islanders. Walk-in clinics are difficult to access. Virtual healthcare has seen disruptions, and all this is backing up our emergency rooms. Members of each party received correspondence from frontline QEHER staff this week outlining the dire situation they're facing. The QEHER is at level 3 overcapacity. Critical area beds aren't being used for their intended purpose, and the backlog of ALC patients are taking up beds and reducing patients' quality of life. In mental health and addictions, we hear about a lack of beds for addiction services. Mobile crisis units have been completely mismanaged. Psychiatric urgent care clinics were discontinued, and there's been no action taken on a safe injection site for PEI. The lack of availability and accessibility of mental health and addiction services is also placing additional stress on ERs, as there's nowhere for them to go and no other options. Then there's the issue of long-term care. We currently have hundreds of Islanders awaiting placement in long-term care facilities, and there's 40 empty beds, just nobody to staff them. This also places additional stress on hospital ERs. Many of the issues are rooted in staff vacancies, and many staff vacancies are being driven by low morale and burnout. It's a vicious cycle that is tearing through our healthcare system, and government must get to the bottom of it. Government doesn't like when we raise these concerns, often trying to say we are attacking frontline staff, which is not true. I want to contest that when government attacks us for asking these questions, they are really attacking the Islanders who bring these concerns forward to us. I think this sitting so far has brought many healthcare concerns to light, and I'm sure there's even more we haven't covered. It's my hope we will begin to see more immediate solutions from government to address the many growing crises in island healthcare. Thank you, Mr. Speaker.
The Honourable Member from Summerside South Drive.
Thank you, Mr. Speaker. The Summerside community, along with a much broader community, has been impacted by the passing of Ellen McPhee. I want to send my heartfelt condolences to her family and friends. Her passing hit me particularly hard. I found myself overcome with grief at the news. I hadn't seen or spoken to Ellen in many years, and I didn't know her particularly well, though I did spend some time with her in our teen years. Still, the news brought me to tears. Upon joining a Facebook group serving as a memorial to Ellen, I found I was not alone in my experience. You didn't have to know Ellen for long before she would leave a lasting and positive impression. As such, Ellen touched many who now mourn her loss. Together, we felt the loss of someone we knew brought light to our world. Too many families, mine included, have experienced loss and harm due to breast cancer. I doubt there are many whose life it has not touched through a mother, a sister, a wife, a daughter, or any of the other women in our lives. It's Breast Cancer Awareness Month. That's what this pink ribbon represents. We don't really need a ribbon to remind us of the magnitude of the issue, though it touches so many lives, not just in October, in a way that is never forgotten. Early diagnosis of breast cancer greatly improves outcomes. I recall speaking at length with Janet Gallant during the 2019 election. She was currently battling breast cancer and was lobbying to see breast density notifications provided to island women, so they would be more likely to be screened. She won that battle, but sadly lost her battle with cancer over the past summer. My condolences to her family and friends. There is, however, more we can and should do for women who have had a dense breast diagnosis. Breast cancer can appear earlier than 40. Too many of us know that all too well. We need to make sure we are well educated on this so they can watch for the signs and catch it early. However, for women 40 and over, PEI has the PEI breast screening program available, and I encourage all men to be aware of the program and all women to make use of the program. Thank you, Mr. Speaker.
The honourable member from O'Leary, Inverness. The honourable member from Charlottetown, West Royalty, third party House Leader.
Mr. Speaker, one of the most difficult episodes of the pandemic was the West Royalty school outbreak. Mercifully, we passed through that and the repercussions were limited. But the outbreak raised the alert level across the island and most particularly in my community. Many families were required to isolate and often from one another. This caused a lot of concern and trauma, and I continue to feel bad for those who spent those days of worry and uncertainty. And it is that uncertainty that drives so much of the hurt caused by the pandemic. In a difficult time, we look for solid foundations upon which they have great confidence and that their families and loved ones are safe. That is one of the reasons that both Liberal Caucus and I are so supportive of mandatory vaccinations. We know that vaccines are the best protection against the pandemic, and vaccines provide the confidence that islanders are seeking. And I remain bewildered that the Premier failed to recognize that in his statement of the winter of 2021 calling mandatory vaccines illegal caused unnecessary uncertainty and delay. Mandatory vaccines are not illegal, and in fact, the mandatory vaccine is an important encouragement for those who remain hesitant of vaccination. Furthermore, Mr. Speaker, a mandatory vaccine in the education system will help to protect our youngest members of our community, and I think we all know the old saying, an ounce of protection is worth a pound of cure. So I will ask government again to reconsider its position against mandatory vaccines in the education system and move forward with this as soon as possible. Thank you, Mr. Speaker.
End of member statements. Questions by members, starting with response to questions taken as notice. The Honourable Premier.
Thank you very much, Mr. Speaker. Yesterday in this legislature, the Honourable Leader of the third party asked a question about the cost of testing kits, in particular the kits used in the mandatory testing process for those departments who are working with vulnerable work environments, Mr. Speaker. The answer to that question, the cost for Islanders, Mr. Speaker, is zero. The testing kits and components are part of the federal government's procurement and provision allotment to provinces, Mr. Speaker, and I hope that clarifies the situation for the Honourable Leader.
The Honourable Minister of Social Development and Housing.
Well, thank you, Mr. Speaker. So a couple of days ago, the member across was asking about money to help seniors with their pets, Mr. Speaker. And so last year, our Seniors Independence Initiative underwent many changes to allow for greater eligibility and scope. And we increased funding and broadened the program to allow seniors to choose what they need. And the program categories that we list on the website, for example, are suggestive, but ultimately the senior has autonomy over how they use funding through the Seniors Independence Initiative program, pets included. Thank you, Mr. Speaker.
Anyone else? Response? No? And for our first question, I'll call on the Honourable Leader of the Official Opposition.
Thank you so much, Mr. Speaker. Last week in the House, when questioned about the state of island forests, the Minister of Environment said this, and I quote, "We've started down a path to do a number of things to hopefully improve it from both the deforestation level and the reforestation level." And the Minister also said that day that his department is still reviewing the data from the aerial surveillance that was taken. But I continue to see in my own district and beyond evidence of accelerating deforestation across this island, with much of it appearing to be clear cutting of mixed forests. A question to the Minister of Environment, Energy and Climate Action. Specifically related to deforestation, what incentives are you considering to encourage island woodlot owners to maintain the health and integrity of their forests?
Minister of Environment, Energy and Climate Action.
Thank you, Mr. Speaker, and that's a really good question. And the basis of that question is something that I agree with. So we have to incentivize woodlot owners to leave their wood standing for a number of reasons, not the least of which is the fact that we need to sequester carbon using mature forests. So we have a number of things that we're trying to get off the ground. I've talked about it in here before. We're looking at biochar and sustainable harvests, but we're also looking at, I've asked my staff to research what a reverse carbon tax, if you will, would look like, where we actually pay you each year to not do anything to your land so that we can continue to count it towards our carbon sequestration for our net zero project. And one of the things that we're really looking at is, there's an alliance forming across the island, and the Woodlot Owners Association is also one that has a number of landowners involved. And is there a way that if we bring them all together, we can create a carbon credit system whereby we would just buy the credits? So I don't necessarily think we should be selling them off island, but we would buy them ourselves so that we wouldn't obviously let the credit for the sequestration leave, but also be in a way that we could help our woodlot owners. So there's a number of things that we're trying to do. We don't quite have it hashed out yet, so I don't want to stand here and say that we definitely have the answers, but I totally agree with the premise of your question. Thank you, Mr. Speaker.
The Leader of the Official Opposition.
Thanks, and I agree with the premise of the answer as well. I appreciate that, Minister. I'm aware, of course, of the complexity and the sensitivity of this issue, but I'm also aware of the importance of maintaining the integrity and the health of our island forests, and of how forest practices are so critical a component of our climate change actions and getting to net zero by 2040. A question to the same Minister. Are you considering, and you sort of alluded to this, although I'll give you another opportunity to expand perhaps, creating a payment for ecosystem services that actually pays landowners for not clear-cutting their land, for example, and for having a forest management plan and for actively improving the health of their forests?
The Honourable Minister of Environment, Energy and Climate Action.
Yeah, thank you. And again, I agree with the premise of this question as well, because I believe that if we're going to impose a carbon tax, which we are, a federally mandated carbon tax that we're already under, to go against people who are polluting, that we should have something in reverse to reward people who are helping us solve the problem that we're trying to solve with our carbon. So I totally believe that we need to come up with it. It may be way out of my pay grade to figure that out. I may have to find somebody much smarter than me to help me figure out what that is, but the staff are currently working on models and what that would look like, and it's something that when we talk to the woodlot owners, they're getting excited about it because they finally feel like there's value in standing wood versus having to look at it as a value someday to cut it all down one time. And those are the conversations and how we shift people's view of looking at their own property, I guess, for lack of a better word. Thank you, Mr. Speaker.
Honourable Leader of the Official Opposition.
Thanks, Speaker. I'm really enjoying this conversation, by the way, Minister, and I agree with you. I think we need both carrots and sticks here. We've talked about a few carrots in terms of incentivising island woodlot owners to maintain their forests and to harvest them sustainably. But likely we're going to need sticks as well. So a question to the same minister, is your department considering, for example, applying a tax against revenue which is generated from clear-cutting forests?
Honourable Minister of Environment, Energy and Climate Action.
Thank you, Mr. Speaker. So again, I agree with the premise of this question too. And I think that this one, albeit it's a little bit more complicated, though I do agree that, again, if you stop at the pumps today and you fill up your car with gasoline and you pay a carbon tax associated with that, you are effectively paying for the fact that you are contributing to climate change here in the world. So the opposite could be said if you clear cut your land, and I've mused in our department that should have an equal type of value that somebody should have to pay in order to do that. So again, we're really too early on for me to say that's how we're going to do that in absolute, and we need to work with the Woodlot Owners Association, and we need to put them in a place of sustainability so that they can view sustainable harvest as an opportunity to monetize what they've owned and what they've nurtured and what they've grown, and also look at that clear cutting isn't an answer for a number of reasons, and that it's hurtful towards our future. So we kind of have to figure out how to blend those two together. But yeah, I think that we're on the same page here. Thank you, Mr. Speaker.
Honourable Leader of the Official Opposition.
Thanks, Mr. Speaker. So one way, and by the way, nobody is suggesting that we do not cut trees down on Prince Edward Island. It's a valuable resource, and sustainably harvested, it can improve both the health of the forest and our economy here on Prince Edward Island, provide jobs. And one way to use the revenue from such a tax, as we're just talking about now on clear cutting, would be to help fund the establishment of lumber mills here on Prince Edward Island, in order that they're actually able to stamp their products. We have no stamping facilities here on Prince Edward Island at all. The fact that there are no stamps here is a significant loss to our economy. A question to the same minister. Having even a few local lumber stamps here would satisfy a lot of the provincial demand with locally sourced timber. And we could even go a step further and certify that all wood stamped here on Prince Edward Island is sourced sustainably. Is that something that your department is looking at, Minister?
Honourable Minister of Environment, Energy and Climate Action.
So, thank you, Mr. Speaker. So recently we met with the Minister of Agriculture and his department, in I guess it's the Justice Department or Planning that would fall under, but we had a conversation about this very issue because it had been brought to our attention by the Woodlot Owners Association, and they didn't feel like they could get the value for their product if we harvested sustainably, because of that exact reason. They had to ship it off island in order to get it stamped, and then that grossly devalued the product they could have at the end. So the Minister's Department is working on a project to help train people so that they can stamp lumber here on the island. And I mean, that's obviously step one, but the second part of your question, the sustainable, I think that's a great idea. And as we move towards more sustainable living here in Prince Edward Island, and we move towards the goals that have been set both by government and by the Legislative Assembly, that we do come up with measures. So I haven't had a chance to think about that because you just said it, but I'm intrigued. Thank you, Mr. Speaker.
Honourable Leader of the Official Opposition.
This will be quite a day already, like 10 minutes into question period, and I understand I need a pedicure, and also I'm agreeing entirely with the Minister of Environment. On the same day, when the minister answered some questions in the House here, he also said, we know we have to take action, so we're working on a number of initiatives inside the department right now that will address it, both in the short term and the long term. A question to the same minister. I agree that we absolutely need to take immediate action. For example, how about government purchasing some woodlots here that are for sale and protecting them, preserving them, perhaps even gifting them to the Island Nature Trust? And when would we see these initiatives here on Prince Edward Island?
The Honourable Minister of Environment, Energy and Climate Action.
Thank you, Mr. Speaker. So you're probably seeing some of them now, though we didn't talk about them because it's not really in my nature to talk about them, but you're going to give me the opportunity, so I'll say. But we have a partnership with Island Nature Trust. We've, I think it was $750,000 we had given them this year to purchase land and protect it. So we're looking at developing that into a more wholesome relationship where we're going to put some synergies between our department and what they do, so that they know what we're trying to do and we know what they're trying to do as far as acquiring land to protect it. So that part is already underway. I've talked about the biochar and the opportunities that we're going to try biochar here. We're going to see how we can use it to allow a sustainable harvest, to have a product at the other end that a farmer could use to help their soil health, to reduce the need for nitrates. And while we have nothing to do with it, I'm very interested in the Willow project that's happening in the Dunk River area. And is the Willow project something that can help us with our nitrate problem? And is the Willow project, because they're fast-growing and regenerative, something that would work really well with biochar? And we could create a system unto itself where we didn't need the nitrates, where the soil health was better, and at the end, the health of the Dunk River would be better. Thank you, Mr. Speaker.
The Honourable Member from Charlottetown, Belvedere.
Thank you, Mr. Speaker. I feel like we might need to pause for like a group hug or something. We've already spoken in this House about the need to see government's plans for reaching net zero, and I'm optimistic that we'll see it soon. But we're seeing the impacts of climate change right now, Mr. Speaker, so we need to be planning for and working on adaptation, and there's an awful lot of work to do. I haven't seen much in the capital budget to support this, however. So a question for the Minister of Environment, Energy and Climate Action. When is adapting to climate change going to be a priority for your government that actually shows up in the budget?
Honourable Minister of Environment, Energy and Climate Action.
Thank you, Mr. Speaker. So a lot of the dollars that you're going to see in the initial stages would be in our operating budget, but I'm sure if you talk to the Minister of Transportation, their adaptations are already at play. If you look at when they install a new bridge, it's higher. When you look at some of the roadways that they have to rebuild, they're building them higher if they're adjacent to waterways. So they've been looking at that from that lens for a long, long time. But the report that we laid down this week is kind of, it has to be the starting phase, because we have to have some formal documentation that says this is where we are and this is where we're heading to before we start planning. So we have to move quickly. I think that what I told the media here earlier this week is we're going to look at creating a plan that's built on the same framework that the net zero framework is, that you haven't seen yet, of course, that I think you'll be impressed with when you see, and we'll build a plan for adaptation under that same framework. And then we're going to take it to Ottawa and say, look, this is where we need help, this is where we need your help financially, and these are the things that we're going to do. Thank you, Mr. Speaker.
The Honourable Member from Charlottetown, Belvedere.
Well, I'm sorry, but I'm hard to impress, Mr. Speaker, but I am looking forward to seeing that report. But in the meantime, the report I have seen, the Climate Change Risk Assessment Report, identified a very high risk to Indigenous communities, particularly Lennox Island. We often hear that only the federal government has responsibility for the financial and program supports that are provided to on-reserve First Nations. But the risks identified in the Climate Change Risk Report do not respect community or jurisdictional boundaries. Coastal erosion, post-tropical storms, heat waves, don't care where you live. So a question for the same minister. What discussions have you had with First Nations leaders on these risks and the role that this government has to support them in responding?
The Honourable Minister of Environment, Energy and Climate Action.
Thank you, Mr. Speaker. So it is a really good question, and I know just from the past practice of government is exactly what you said, that it's a federal responsibility, but I don't believe that is true. And when I was the Minister of Transportation, we agreed to work with Lennox Island to pave roads. We agreed to work with Chief Gould to do some work in his community, which was done, and I know the current minister has carried on that way. So I think that's, number one, that's a very important plank to lay out, that I don't think this government views that relationship the way previous governments had. We work with Lennox Island as well. Like, they've been a part of a sustainable communities project we're working on. There's some really bright people involved that are really exciting to work with in that Lennox Island project, and they're going to do some really good things as far as that goes. And when it comes to adaptation, I don't think that we're going to leave any part of the island behind. We have to look at the flood maps, which we're going to release here very shortly, which are going to contribute even further to this conversation. And they, again, aren't going to say things that we should be happy about. So we have to take this super seriously. We have to move really, really quickly. And, you know, I've had a lot of focus on our path to net zero, but I believe that this is the most crucial piece of work for PEI in its future. Thank you, Mr. Speaker.
The honourable member from Charlottetown, Belvedere.
Thank you, Mr. Speaker. And as I said yesterday in discussions with media, that we can't afford to wait. We can't afford to wait months, let alone years. And so, you know, again, we are waiting now for these reports, but the time is absolutely of the essence. There are clear risks to other communities in PEI as well, and you've mentioned that perhaps there may be something coming, and this includes, you know, downtown Charlottetown, Summerside, uptown Mount Stewart, and of course our North Shore tourism communities, just to name just a few. Minister, how are you working with municipalities to help them plan and adapt to climate risks, and what are you going to do for smaller rural municipalities and unincorporated communities?
The honourable Minister of Environment, Energy and Climate Action.
So thank you, Mr. Speaker. And it's a really good question. And I mean, of course, this is where it gets complicated. And even through our net zero planning is where it gets complicated, because I really don't have the levers to tell the city of Charlottetown that you have to do it, though we've set goals in the legislature through legislation that's going to, you know, push them to have to move that forward. I'll go back to what I believe. I think we have to have a comprehensive plan, which we're working on. We have to get it out the door quickly, because we have to get to Ottawa, we have to find funding, and we won't leave anybody behind. So we're not going to leave the city of Charlottetown behind, and we won't leave an unincorporated community behind. We have to look at this as holistic. We're a small province, and I think we're good partners, and I expect that we'll find good partners when we go to Ottawa. Thank you, Mr. Speaker.
The honourable member from Charlottetown, Victoria Park.
Mr. Speaker, the minister has been asked to come in to the Health and Social Development Committee twice and had scheduling conflicts, so I'll get some of these questions in here. As Dr. Morrison wrote in her 2016 annual report, our health is about so much more than just our physical bodies. The social determinants of health include things like housing, income level, food security, culture, relationships. If we consider people accessing the services of the Community Outreach Centre in Charlottetown, these factors are even more important. Question to the Minister of Social Development and Housing: how do you work with the Minister of Health in terms of fulfilling your responsibility to Islanders as it pertains to the Community Outreach Centre?
Honourable Minister of Social Development and Housing.
Thank you, Mr. Speaker. And indeed, the social determinant healths are key to the health of Islanders, and especially those at the Outreach Centre. And that's one of the key areas that the Outreach Centre serves with those vulnerable Islanders. And in fact, that's why we have a working group that's made up of more than a dozen groups that in fact focus on some of those social determinants of health. And that's why those service organizations are actually in the Outreach Centre to provide those services to those Islanders. And Mr. Speaker, we work closely with the Department of Health on this file. And Mr. Speaker, there's a number of items that go back and forth. I mean, we're looking, for example, Deacon House is one that's in the Department of Health right now, and we're looking to take that over in the Department of Social Development and Housing. When it comes to a safe consumption site, Mr. Speaker, I think that's a key thing that we need to look at in order to make the Outreach Centre successful as well. And again, that's something we have to work directly with the Department of Health on. Thank you, Mr. Speaker.
Charlottetown, Victoria Park.
A key thing you need to look at, I would have expected that you would have more than that to say about a safe consumption site by now. The Salvation Army and the working group provide valuable services at the Charlottetown Outreach Centre, but there are no health professionals purposely stationed there, and that's a glaring gap. Question to the Minister of Social Development and Housing: why are you not offering health services at the Community Outreach Centre?
The Honourable Minister of Social Development and Housing.
Well, thank you, Mr. Speaker. And when it comes to the Outreach Centre, Mr. Speaker, I just want to highlight again that this is a service that started really less than 2 years ago, and it is serving an amazing need. And Mr. Speaker, I think when it comes to health services, that is a whole other step forward for the Outreach Centre that can be considered in the future, Mr. Speaker. I will say that one of the things that is very challenging, and one of the things we've been asking for and working with the Department of Health for a long time, is having a counsellor and a psychologist there at the Outreach Centre, and that is a gap that I think would be the first thing that I want to address, and we're going to continue to push for that. Thank you, Mr. Speaker.
Charlottetown, Victoria Park.
You keep talking, but nothing happens. The people in our community are not feeling safe. Feeling safe is also a social determinant of health. In order for both clients and for those who live in the surrounding areas to live healthily, they must feel safe, and currently they do not, and have not for quite some time. Question to the Minister of Social Development and Housing: why do you think this is, and what are you going to do to fix it?
The Honourable Minister of Social Development and Housing.
Well, thank you, Mr. Speaker. And from the very beginning, when I took over this file back in February, and we were discussing, about moving the Outreach Centre from its then location on Weymouth Street, I said, what we have to do is we need to work with the community, and we need to make sure they were safe. And that was my input. That was my input through my department to the working group. And Mr. Speaker, the working group, I have great faith and trust in them, and that's what I've done, is I've asked them for guidance along the way. And I have said to my representative on the working group, I said, look, I really think, for example, we need to do things like build a fence. And they said, I will take that to the working group, and we'll do that. And so, Mr. Speaker, this is a real slap in the face to those experts, those islanders who are working so hard to make the Outreach Centre successful and safe, for this member to stand up and say they're not doing a good job. Thank you, Mr. Speaker.
Charlottetown, Victoria Park.
Offense. Offense. You need to show up for our community. When we are dealing with vulnerable populations, it is extremely important that confidentiality not trump safety. I have had a few people come forward with concerns. I know that there have been confidentiality agreements signed, and now staff are scared to speak out, as well as the working group. NCPEI expressed concerns about this as well. Question to the Minister of Social Development and Housing: will you commit here today to having a third party involved where people can be safe to share their concerns?
The Honourable Minister of Social Development and Housing.
Yes. Well, Mr. Speaker, yes. I'm a little confused by the member's questions and where she's going. Last time I checked, there was an MLA that represented the area. There was a councillor that represented the area, and they can share the concerns with the member, with the councillor. And Mr. Speaker, if a third party is needed and the working group recommends it, I will definitely take that recommendation and act on it. Thank you, Mr. Speaker.
The Honourable Member from Summerside, Wilmot.
Mr. Speaker, I've had a constituent bring it to my attention that for people who are living with diabetes and PEI, while their insulin is covered, their needles are not. And that may not sound like a big deal, but for people who are on a fixed income, it's a huge deal. I am hearing from people who are reusing their needles with painful consequences. Question to the Minister of Health and Wellness: why do we cover insulin but not needles when there's literally no other way to take this necessary medication?
Honourable Minister of Health and Wellness.
Well, thank you very much, Mr. Speaker, and thank the member for the question. And I think it's one of the great things that we see in the legislature here when things are brought forward. Just for example, Mr. Speaker, the $5 fee that was mentioned the other day, and I took that back, directed the department to let's get rid of that with regard to skip the waiting room. So that's in the process. And I do. No,
It's your decision.
Honourable Minister. Honourable Minister.
It's not that easy, is it?
Honourable Minister has the floor.
Yeah. And it's a very valid point that the member does bring forward. Yes, we have to continue to fund insulin strips. We have increased the number of strips, substantially increased the number of strips for pregnant women. But with regard to needles, yes, it's an excellent point that the member brings forward, and certainly will proceed down that road. Thank you.
The Honourable Leader of the Third Party.
Thank you, Mr. Speaker. Mr. Speaker, the last sitting In the last sitting, the Liberal caucus brought forward concerns around the province's plan to expand online gaming into island homes in the middle of a pandemic. Documents from ALC described the pandemic as an opportunity to launch this online gaming platform, something they've long sought to do, regardless of impact on islanders. While the minister initially resisted this sinister plan to exploit islanders, her mind clearly changed when she saw the money it could generate. Question to the Minister of Finance. What is the current status of PEI's plan to introduce an online gaming platform into island homes?
The Honourable Minister of Finance, Deputy Premier.
Thank you, Mr. Speaker, and thank you, Honourable Member. There has been no change of my mind. I've said from very early on that we are waiting for the responsible gambling strategy that we are now working on. It's not a sinister plan. It's to work with Atlantic Lottery Corporation. It's a corporation, a Crown Corporation. It's owned by the 4 Atlantic provinces, and we will work with not only ALC but with all islanders to ensure that what we do is the safest form of gambling for all islanders. Thank you, Mr. Speaker.
The Honourable Leader of the Third Party.
Mr. Speaker, the Minister insists this wasn't designed to exploit islanders, but the documents suggest otherwise, saying the opportunity would demise if they didn't act during the pandemic. It's clear ALC and government saw an opportunity to increase revenue, and they took it, regardless of impact on islanders. In the spring, this House passed a motion calling on government to release an update on responsible gaming strategy within 6 months. Here we are 8 months later and nothing. Question to the Minister. When can islanders expect your government to release an updated responsible gaming strategy to PEI?
The Honourable Minister of Finance, Deputy Premier.
Thank you, Mr. Speaker. Honourable Member, I do not have a date for you, but I will check with the department to see when we are looking at for a date. I know the department has met with the consultant that is doing the work. I've met with a number of people who are involved with responsible gambling on Prince Edward Island and ensuring that islanders are safe, and I have no problem bringing that date back when I have one. Thank you.
The Honourable Leader of the Third Party.
Mr. Speaker, last week we saw a report from New Brunswick saying that the online gaming platform generated more revenue in 1 year than expected, and that initial revenue projections were low. We've heard the Finance Minister talk about the projections provided by government-owned gambling sites, but it appears they didn't work in New Brunswick. Even Nova Scotia has taken a step back to assess the timing of this plan and say protections that should be put in, and any protections that should be put in place. Question to the Minister of Finance. Considering the reports of New Brunswick, do you still believe inside protections alone are sufficient to stop problem gambling?
The Honourable Minister of Finance, Deputy Premier.
Thank you, Mr. Speaker. Honourable Member, the projections that we made were during COVID. We weren't sure how, whether people were going to be able to get out, whether they were going to be able to socialize, and we realize, and we'll see through the public accounts and that we are in a better place than we thought we'd be. And yes, the projections that were there were low, and I think you look across government, we erred on the side of caution for all projections, and we are in a better place, and it's because of islanders. And I will look to the responsible gambling strategy to help us navigate where we're going to go next. Thank you, Mr. Speaker.
The Honourable Member from Charlottetown West Royalty.
Recently, we've heard many discussions in this House about privatization of healthcare services, and it appears there's a fundamental disagreement. There's no debating that Medavie is in fact a private company, so I'll let islanders decide for themselves if this is privatization. One thing we have not heard explained is why did the government change the management structure of mobile crisis units from public with Health PEI to private with Medavie? Question to the Minister of Health. When did you decide that Health PEI could not manage mobile crisis units, and how did you come to that decision?
The Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker, and thank the honourable member for the question. I do not see it overall, Mr. Speaker, to be honest, with regard to, it's a partnership. You look at the employees, you look at the specially trained nurses, social workers. Mr. Speaker, they are employees of Health PEI. We have synchronization, if you like, with the 911 system, which is vital, a vital component of the mobile response units, Mr. Speaker. And that is where Medavie, Island EMS comes in. You look at the department itself, Mr. Speaker, and that the oversight, the monitoring, if you like, of this great initiative that was, yes, I'll be the first to say it would have been great if it had have hit the road sooner, could have hit the road sooner. It is there now. It is providing a great service. And again, Mr. Speaker, it's that partnership.
The honourable member from Charlottetown West Royalty.
Well, you had enough time that Health PEI could have done this, and unfortunately, it wasn't done that way, and now it's been outsourced. The way the government has handled the crisis units has thrown the whole process into question. The Deputy Minister was involved in efforts to advocate on behalf of the privatization concept with a company with his brother as senior manager. According to the conflict of interest policies, even the appearance of a conflict can be considered a conflict itself, Minister. Question: was there a public tender for mobile crisis unit services, or was the contract given to Medivy without a competitive process?
The Honourable Premier.
Mr. Speaker, I would just caution the honourable member before he convicts someone of being guilty of someone that we let a process take place where the Ethics and Integrity Commissioner is reviewing the matter, Mr. Speaker. We shouldn't rush to judgment on the guilt of a public servant, Mr. Speaker, without making sure we go through the proper service, Mr. Speaker. And I would again say for this honourable member who knows very well, Mr. Speaker, that Medivy is a not-for-profit company, Mr. Speaker. It's not a private company. Nobody is benefiting and putting money into their pockets, Mr. Speaker, by this. They have been a partner for many years within this province with the healthcare delivery services, Mr. Speaker. And prior to the implementation of the mobile mental health units, Mr. Speaker, anybody in a situation with their mental health called 911 and Island EMS showed up at the door, Mr. Speaker.
Charlottetown West Royalty, your second supplementary.
And that's why we're here, Mr. Premier. According to you, the Deputy Minister was initially cleared of the conflict of the Office of Ethics and Integrity, but in light of new information brought forward by the Guardian as a result of the Freedom of Information request, we know the Deputy was more involved than initially disclosed. The Premier has not ordered a second look into the situation to determine whether all rules were followed. Question to the Minister of Health: why did the initial review not examine emails that clearly showed the Deputy's continued involvement in the file despite potential conflict concerns?
The Honourable Premier.
Again, Mr. Speaker, I would ask the honourable member to be cautious in how he convicts and presumes guilty someone, Mr. Speaker, who as part of their disclosure process, which they're obligated to do, explained the potential relationship with his brother who works at Medivy, Mr. Speaker. Medivy is a not-for-profit company, Mr. Speaker. I've asked, in light of the new information, for the Ethics and Integrity Commissioner to review the information and provide her advice, Mr. Speaker, which is her job, Mr. Speaker, and it's not the job of this honourable member to try to convict somebody, Mr. Speaker, wrongfully so, until such time as they've had a chance to be reviewed, Mr. Speaker. And I think it's a borderline offensive question, Mr. Speaker, that you would make that suggestion in here, Mr. Speaker, with the protection of the rail in making it.
Larry Inverness.
Thanks, Speaker. There certainly has been a lot of concern raised about the creeping contracting out of healthcare services in our system, Mr. Speaker. The decision to hand over parts of mental health care to a non-governmental sector is the leading reason for that particular concern, Mr. Speaker. For that reason, it is worrisome to learn that the Deputy Minister of Health prepared talking points that advocate on behalf of a company that is delivering a non-tendered contract. Mr. Minister of Health, what steps did the Minister of Health take after he learned that the Deputy appeared to be assisting a company in advocating for the delivery of public health care services where the Deputy's brother worked? Did you do anything?
The Honourable Minister of Health and Wellness. The Honourable Premier.
Mr. Speaker, again, I guess, we see a trend in here, particularly with this particular party, Mr. Speaker, and wanting to make everybody guilty of something, Mr. Speaker, without having done maybe anything wrong, Mr. Speaker. The honourable member is suggesting, I think wrongfully, that something untoward was done here, Mr. Medivy is a not-for-profit company, Mr. Speaker, who has been a long-time partner in the delivery of health service and PEI. When he was the minister, Mr. Speaker, he engaged them to actually deliver services pertaining to home care, Mr. Speaker. I don't think he was talking then about this being a privatization of service in any way, Mr. Speaker, but trying to fully utilize the services that are at our disposal to try to deliver better health care, Mr. Speaker. And I just think that we should be careful before we try to presume some kind of wrongdoing here, Mr. Speaker, before someone is given their time to be heard and for the Ethics and Integrity Commissioner to make their filing.
Larry Inverness.
Mr. Speaker, there's a big difference between delivering ambulance services and delivering actual services of health care. So as of right now, we certainly heard this government has only delivered vague promises this government on health care. In fact, the only solid commitment I have heard that this government seems to be able to deliver on is that thousands of islanders will not get a family doctor. Now clear that the government will definitely deliver on that one. Question to the Minister, what role will the non-governmental sector play in your vague plan to operate and deliver services at these medical homes and neighbourhoods?
The Honourable Premier.
Well, Mr. Speaker, I heard the honourable member tell me yesterday that he tuned into the, I think he called it a dog and pony show, which was the AGM of the Health PEI Board, Mr. Speaker, in which the Health CEO talked about how we have to move out of the 1970s, Mr. Speaker, with the view that everybody needs a family doctor, Mr. Speaker, something that he and his party have been promoting, I would say, tirelessly in here, Mr. Speaker, for 11 years in government and now for 30 months in opposition, Mr. Speaker. So we have to look, Mr. Speaker, at doing things differently and utilising the partnerships we have across the board to deliver healthcare services for Prince Edward Island, Mr. Speaker. And Island EMS is an important part of that healthcare delivery system, Mr. Speaker, and we hope we can utilise them, Mr. Speaker, well into the future.
The Honourable Member from O'Leary, Inverness, for second supplement.
That's all great to say we're going to do something different, but I haven't noticed that the Canada Health Act has been changed, Mr. Speaker, or the process of accreditation of our healthcare services has changed. That hasn't changed that I'm aware of. The Minister clearly decided that the private sector was better equipped to deliver some of the mental health care services. We know that the Deputy's role has now been investigated and we're awaiting a probe. But in the meantime, has the Minister explained to his Deputy that his actions have raised serious concerns in the public about the health care delivery in these homes and how it might impact the Canada Health Act or accreditation, Mr. Speaker?
The Honourable Premier.
Mr. Speaker, I would again remind one of the longest-serving members in this legislature, Mr. Speaker, that the deputy is my deputy. It's not the minister's deputy, Mr. Speaker. I appoint them, and the responsibility lies with me, Mr. Speaker. I think he knows that, Mr. Speaker, but he chooses to ask the question in a different way, perhaps to try to gain some kind of partisan advantage, Mr. Speaker, which I'm at a loss to figure what that is. Mr. Speaker, Island EMS is an important partner in the delivery of healthcare services of Prince Edward Island. They have been since they were initiated here, Mr. Speaker, and I look forward to working with them into the future, Mr. Speaker, just as the honourable member did when he was health minister, but now all of a sudden he says we shouldn't do it, Mr. Speaker, because he's not in government.
The Honourable Member from Charlottetown, West Royalty.
Thank you, Mr. Speaker. The price of fuel has been very volatile as of late. A lot of people talking about this from Tignish to Surrey, as well as parts in between. Today, there was news with a slight decrease in the price of items like gas and furnace oil, but the trend, though, is in the other direction. Question today to the Minister of Social Development and Housing. The increase in energy costs will be impacting low-income islanders the most, especially with winter approaching. What type of supports does your department currently offer to help low-income islanders with these rising energy costs?
The Honourable Minister of Social Development and Housing.
Well, thank you, Mr. Speaker. As the member knows, we have a variety of supports available across the board. For those on social assistance, have monies allocated towards that, as well as on the housing side of things. We provide supports. But, Mr. Speaker, we work with partners primarily to help do that. And one of those partners is the Salvation Army, Mr. Speaker. And they have a program that they specifically provide money for, a home heating program, and we do fund them. Thank you, Mr. Speaker.
The Honourable Member from Charlottetown, Winslow.
Thank you, Mr. Speaker. Last year, the average cost of furnace oil at this time was about 70 cents a litre. Today, it is just shy of $1.20 a litre, which is a 70% increase year over year. Now, with the increase in the energy costs, the reach of supports to the vulnerable islanders will be lessened. Essentially, $200 of furnace oil last year is a lot less litres this year. Question to the same Minister of Social Development and Housing. What steps are being taken to factor in the significant increase in energy costs for vulnerable islanders, including with your partners that you mentioned in your previous answer?
The Honourable Minister of Social Development and Housing.
Well, thank you, Mr. Speaker. So, in fact, we're working with the Salvation Army to look at the parameters around the program and make adjustments as necessary, because we're seeing such a large increase in these fuel prices. For example, there are thresholds as to who can qualify for the program. So we're looking at what we might need to do to raise those income thresholds. We're looking at increasing the maximum amount that a household can get for that. And Mr. Speaker, right now the eligibility period is from January to March, so we're looking at maybe extending and expanding on that eligibility period. Thank you, Mr. Speaker.
Charlottetown Winslow, your second supplementary.
Thank you, Mr. Speaker. The rising energy costs are not the fault of Islanders, of course, but they are the ones that are paying for it. And of course, these increase in energy costs, they impact island families. A question again to the Minister of Social Development and Housing. We do appreciate you're looking at the thresholds, but I'm asking maybe today if you might commit to helping low-income Islanders meet this challenge by either increasing the support directly for the home heating program or maybe working with the Minister of Climate Action to make alternatives like heat pumps more readily available.
The Honourable Minister of Social Development and Housing.
Thank you, Mr. Speaker. And of course, I always will support initiatives to make heat pumps available for low-income islanders that own their own homes, and we need to look at how we can do that possibly for landlords as well, Mr. Speaker, and that's a tough file. But, Mr. Speaker, I can definitely say we're going to be increasing the funding to the Salvation Army. We're going to change some of those parameters around the program, make adjustments, and Mr. Speaker, I expect we'll make an announcement within the next couple of weeks.
Honourable Member from Summerside South Drive.
Thank you, Mr. Speaker. I have constituents who have been telling me that the coverage of the walk-in clinic in Summerside is not enough. The hours listed are Monday to Friday, 10 to 4, and Sunday afternoon. But there's also a family practice run on top of the walk-in clinic. Those who are in the family practice are often waiting hours as the doctor is busy with walk-in patients. The walk-in patients sometimes can get in, and sometimes they can't, due to demand. A question to the Minister of Health and Wellness. Is the walk-in clinic really available when it's essentially double booked as a family practice and a walk-in clinic during the same hours?
The Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker, and thank the member for the question. And, you know, as we've seen over the last few days, Mr. Speaker, that there are challenges that come up on a regular basis within the healthcare system. Certainly appreciate where the member is coming from. I think it's one of the things, too, though, Mr. Speaker, as we move forward as a government, as an administration, with regard to medical homes, medical neighborhoods, that these are the types of things, Mr. Speaker, that we have to take into account, that we do know that we can do better, and this is a means of doing so. And certainly look forward to ones from the department, Mr. Speaker, from Health PEI, who are much smarter than I am, to give a briefing to the members of the legislature, any of them who do want to attend, to give that update on how the concept, how medical homes and neighborhoods will work and roll out. Thank you.
Honourable Member from Summerside South Drive.
Thank you, Mr. Speaker. I didn't hear an answer to my actual question about whether there's actually a walk-in clinic available, but perhaps in the meantime, the Minister can just change the hours on the website to say maybe all the time. Yet more issues arise as the 20,000 Islanders without a family doctor are told to make use of the walk-in clinics. We know from the Me Too movement and from the rising awareness in society that there are many women who have survived sexual assault and still live with trauma. There's only a male doctor available at the clinic in Summerside. A question to the Minister. Do you think it's fair that the only option for a sexual assault survivor is to see a male doctor when this can be extremely triggering for them?
The Honourable Minister of Health and Wellness.
Well, thank you, Mr. Speaker, and thank the member for the question. And yes, I would have to agree with the member on this. Having said that, Mr. Speaker, it's certainly under the jurisdiction of Health PEI with regard to where the walk-in clinics are, how they're staffed. We do have to provide that service as much as possible across the board. But I do appreciate where the member is coming from and the context of the question that he does put forward, Mr. Speaker. Thank you.
The Honourable Member from Summerside South Drive, final question.
Thank you, Mr. Speaker, and I appreciate the Minister's answer on that. Of course it isn't, yet that's the reality of it, though the power to change that's in your hands. A question to the Minister. Will you commit to ensuring that female doctors can be made available as an option at our walk-in clinics across PEI?
The Honourable Minister of Health and Wellness.
Well, thank you very much, Mr. Speaker. And you know, you look at the context of the question that the member has put forward. What we as a government want to ensure, like we hear time and time again with regard to the number of ones in the registry, what we are moving forward with, yes, we want to provide all Islanders with the very best service in the most appropriate location, Mr. Speaker. And with that, as we do move forward, when we do have our greater collaborative practices, medical homes right across the province, then we will have the services to be able to be provided that are needed, and whether they are gender specific or just whatever they may be, Mr. Speaker, to have them provided in the best space possible. Thank you.
End of question period. Statements by ministers. The Honourable Minister of Fisheries and Communities.
Well, thank you, Mr. Speaker. Mr. Speaker, as Minister responsible for development in rural areas, I understand how important it is to have the voices of our island youth heard and represented in rural communities. We need young islanders and future leaders to participate in current conversations and to bring new perspectives to communities across Prince Edward Island. That is why we recently launched a pilot program called Youth on Board to encourage youth to volunteer and get involved in rural municipal boards, NGOs, and nonprofit community groups across Prince Edward Island. The goals are to give young people a chance to be mentored and encourage new members to join rural community boards and groups. Mr. Speaker, the organizations will also benefit from the ideas and viewpoints of our young islanders. Mr. Speaker, the program is for students to grade 10 to 12 with rural PEI address who can commit to a 7-month learning experience and attend a minimum of 5 board meetings. Mr. Speaker, I am pleased to announce that 37 students have been matched with an organization across the island. The first training session happened on October 8th, which I attended, and I'm happy to say it was a success and it was great to hear from these young people. Our department is working closely with the students, the mentors, and the organizations involved. Training sessions will also be provided for the mentors, and we will be closely involved every step of the way to help make the program as a success as possible. Mr. Speaker, volunteer boards are often looking for new members, and the perspective of young people in our province is needed. This program will give youth valuable leadership skills and build their community ties, while also providing boards with energetic new members. Mr. Speaker, I want to thank all the community stakeholders and everyone involved in this initiative, and I look forward to continued collaboration across Prince Edward Island. Thank you, Mr. Speaker.
The Honourable Member from Summerside, Wilmot.
Thank you, Mr. Speaker. It's a pleasure to speak to this, and I will say I think this is a fantastic announcement. Opportunities for youth to participate in boards, it increases their resume, it does so much for them, but it also does, as the Minister said, enrich the conversation that is happening around the table. I think any opportunity we have to have young voices included in the discussions that we're having benefits all of us. And I would go so far, Mr. Speaker, as to say this legislature would have been greatly improved if we had made pathways to allow more young voices to be included in the discussions that bring us to these tables. So I applaud the Minister for bringing this forward, and I encourage you to look for more opportunities to genuinely make meaningful contributions for youth available. Thank you, Mr. Speaker.
The Honourable Member from Tignish, Palmer Road, Deputy Speaker.
Thank you, Mr. Speaker. And I think this pilot project has great potential. Coming from a 4-H background and being involved with 4-H, their mission is very similar to this, is to get youth involved and get them into the community. With 4-H, the members, they run the club. They hold every executive position there, and they are mentored by leaders from within their communities that they live in, Mr. Speaker. So it has great potential for many youth across the island to get involved in their communities, in different boards. I know in my own community of Tignish and my involvement with the Irish Moss Festival over the years, we always try to have a student in place to chair the Irish Moss Festival, and we mentor that student. They'll come back the next year, they'll have more confidence, they conduct a meeting. So it's teaching them at the same time to fill those positions that are much needed within the communities. And we've had great success with that over the years. In fact, one of our students went on to be hired by the municipality, and after that became the CAO of the town of Tignish. So there's great potential to bring students in youth into these organizations and these boards and give them the skills they need and the knowledge they need to be successful. Thank you.
The Honourable Minister of Agriculture, Land, Minister responsible for Justice, Public Safety and Attorney General.
Thank you, Mr. Speaker. We have spoken in this House about the importance of having access to life-saving drugs. The most recent addition to that list was Trikafta, and I'm proud that our government was able to help these families. Mr. Speaker, the life-saving drug I'm speaking to today is Narcan. This drug is just as important. It addresses a very real opioid problem affecting thousands of people in communities across Canada. As Minister of Justice and Public Safety, making sure our communities are safe is non-negotiable. We know that drugs like fentanyl and other opioids are right here in Prince Edward Island. We can't turn a blind eye to these realities. With law enforcement and community organization partners, we are working to address the presence of these dangerous drugs. Mr. Speaker, today we are taking a particular step by helping Charlottetown, Kensington, Summerside Police Services buy 150 naloxone kits. When a police officer responds to an emergency and they see a potential overdose, the officer needs to have the right tools to save them. That's what Narcan does. Narcan saves lives, Mr. Speaker. Making sure officers have access to these kits so that they can use them on someone who is at risk or is overdosing and reduces fatal consequences. Mr. Speaker, as I said, this is a particular step to address the fatal consequences of illegal opioid drugs. There's more work to be done on this and on the other harm reduction and upstream programs and services that will improve community safety and well-being. I hope all members here will work with me along with our important law enforcement and community organization partners to explore the different solutions that can make communities safest as they can possibly be. Thank you, Mr. Speaker.
Honourable Member from Summerside, Wilmot.
Thank you, Mr. Speaker, and I thank the Minister for bringing this forward because this is absolutely an important conversation for us to be having. Naloxone is a powerful tool that actually a number of my caucus mates are trained in how to administer. We're very familiar with the struggles of people who are potentially suffering from an opioid overdose, and a number of my caucus mates have gotten themselves trained in administering that drug. I think having this with police officers, having that tool available for them is an absolutely important step. From the perspective of the law enforcement officers, I can't imagine what it is like to be attending an overdose and not have the tools you need to intervene and save a life. That would be awful. So this is a critical step forward. I think it's very important. And another important thing to note with naloxone is if you administer it to someone who does not necessarily need it, isn't having an overdose, it's harmless. So it's a really powerful tool to have. The only thing I would add to this is we have an ever-increasing number of trainings that police officers are required to have, and that's important for them to be up to date on that. To administer naloxone properly, you have to be trained. So making sure that the training budgets for municipal police forces are up to snuff for what they need to be to meet all of these ongoing training requirements is one thing I would ask the Minister of Justice to make sure you are factoring in, and naloxone has a regular expiry date, so making sure that there will be additional consistent ongoing funding to make sure this necessary drug is in the hand of law enforcement is the other thing I would ask for. But I thank you for this announcement, Minister. Thank you, Mr. Speaker.
The Honourable Member from Charlottetown West Royalty, Third Party House Leader.
Thank you, Mr. Speaker, and this is a good announcement, and you know, I want to say, I guess, but I'm not sure it gets to the root cause of the issues in our province. I mean, it's a small step to deal and to help islanders, but when it comes to addictions, part of reducing harm, Mr. Speaker, is getting to the source of the issue. And when it comes to overdose and addictions and mental health are at the core of that issue. Too many islanders are struggling with addictions, and we all know getting access to addiction services is the real struggle in our province. And I truly feel that those experience addiction from their families who feel they have nowhere to go or any kind of help out there. I would like to encourage the government to do a comprehensive overview of Prince Edward Island's current situation regarding opioids, naloxone, and opioid-related emergencies like overdoses. And I've said before, prevention is the key here. We need to focus on that. And prevention is access to addiction treatment and when someone needs it. And Islanders simply do not have that at this time. The government needs to get to the source of the issue and address it. Islanders need timely access to addiction services. Islanders need appropriate access to mental health services. The Liberal caucus have been pushing for a safe consumption site in this province. We've been told it's coming, but it's not coming fast enough, and we have to do it right. So we need to work towards that. Again, thank you for this announcement, Minister. It's a small step and an important one, and we need to keep working together. Thank you, Mr. Speaker.
End of statements. Presenting and receiving petitions. Tabling of documents. The Honourable Minister of Finance, Deputy Premier.
Thank you, Mr. Speaker. Mr. Speaker, by command of Her Honour the Lieutenant Governor, I beg leave to table public accounts volumes 1, 2, 3, A and B for 2020-2021 for the period ending March 31st, 2021. And I am very pleased to lay these before, during the House for the fiscal year 2020-21. It's the first time in the province's history that the public accounts have been tabled inside the rail while the House is in session. It's the annual fiscal summary and accountability report for the province of Prince Edward Island as audited by the Auditor General. These statements for 2020-2021 show a lower than anticipated deficit of $5.6 million. Our government looks forward to ensuring Islanders are supported through the remainder of the pandemic and continuing the growth of our strong island community and economy. And I move, seconded by the Minister of Transportation Infrastructure, that the said document be received and do lie on the table.
Shall it carry? The Honourable Minister of Agriculture, Land, Minister of Justice, Public Safety, and Attorney General.
Mr. Speaker, by leave of the House, I beg to table the Judicial Remuneration Review Commission. And I second it, and I move and seconded by the Minister of Finance and Deputy Premier that this document be now received and do lie on the table.
Shall it carry?
Carry.
No more tabling? Okay, reports by committees. Introduction of government bills. Government motions, orders of the day government. The Honourable Minister of Finance, Deputy Premier.
Thank you, Mr. Speaker. I move, seconded by the Minister of Transportation, that the first order of the day be now read.
Shall it carry?
Order number 1, consideration of the capital estimates in committee.
The Honourable Minister of Finance, Deputy Premier.
Thank you, Mr. Speaker. I move, seconded by the Minister of Transportation Infrastructure, that this House do now resolve itself in a committee of the whole House to take into consideration grant of supply to Her Majesty.
Shall it carry? The Honourable Member from Tignish Palmer Road, Deputy Speaker to chair the Committee of the Whole House, please.
House is now in committee of the whole House to consider the grant of capital supply to Her Majesty. A request has been made to bring a stranger onto the floor. Shall it be granted? Please state your name and position for Hansard.
Gordon McFadgen, Assistant Secretary to Treasury Board.
Thank you very much and welcome. Members, it was the wish of the committee that we would come back to page 7, capital expenditure for economic growth, tourism, and culture on the capital improvements section when information was received. That information was distributed yesterday, so it's a pleasure of the committee that we now go back to that section. Okay, so this section has been read and is now open for debate. And I'm now taking Tyne Valley Sherbrooke.
And thank you for bringing this information back. It is helpful to get a little bit more of a clear breakdown of where spending is happening. Still probably some questions as to how those decisions were made, but I do want to just go back to the section on the golf courses and just note that you know, I think for the purposes of our discussion for the capital budget, I'm happy with leaving this here with this information, but I just wanted to highlight that, you know, next time when we get to the operational budget, I would really like to see a cost-benefit analysis of the spending that we dedicate to these golf courses, and we hear about their spin-offs for tourism and, you know, in all different areas, but I'd like to see a bit more detail into exactly what those spin-offs are and how much, you know, how much economic benefit there really is for island businesses and for, you know, for our economy. We just need more information on that. But for the purpose of this, I'm satisfied with what's here at this time.
Thank you. Leader of the third party.
Chair, just a question on the provincial parks. So Linkletter will receive 20 new sites, including on-service sites to three-way service sites. Is that going to happen this year?
That's in their plan.
Okay, thank you.
Leader of the third party.
That's good, thanks.
Any other questions? Shall this section carry? Total capital expenditure, economic growth, tourism, culture, $1,800,000. Shall it carry? Honorable members, we are now moving to Environment, Energy, and Climate Action on page 11. Land, appropriations provided for land purchases, buffer zone buyback and restoration, $500,000. Charlottetown Belvedere.
Thank you. This appears to be a new project. Could you give us any details on this, since we're being asked to fund it to $500,000? Could I get some background or details on that, please?
Actually, Mr. Chair, I do have a document to be handed out, so I'd like to table it and have it distributed.
Sure. Yeah, so we'll have that distributed at the moment.
Would we be able to ask Chair for a moment to be able to review that before we go to questions?
Yep.
Thank you.
Does anyone else have any other questions? We can come back to this one.
Chair, can I just check? When we were doing the education section, we had gone down to the last item, but I don't know if we'd actually completed the whole total. Is that still outstanding?
On education, it's completed.
It's completed?
I read and carried it, yes, the total.
Okay.
Yep. Yep.
Just checking. Thank you.
Yeah, leader of the third party.
Was there consultation done with the farming community on this buffer zone buyback? Do you know? What was their feedback?
I'm unaware of any consultation that has been carried out to date. I think just based on the note that you'll get, I think it's they're planning on kind of a voluntary program first off, so that where people are interested, we'll have a fund available to buy the relative buffer zone and/or field or parcel of property that could be available.
Okay.
Leader of the third party.
So are these documentations going to give us a breakdown of the $500,000 and what it's going to be spent on?
It's what was handed to us from the department, so, yeah. yeah.
We're just
from
going to buy land with
Yeah,
it.
Going to buy land, yeah.
Leader of the third party?
That's good for now, thanks.
Charlottetown Belvedere.
Thank you. So this is separate from the ALICE program that already exists, which provides that kind of ongoing support to farmers on a per acre basis to do some similar kind of approach, but it's a separate, this is a purchase of land, is that correct?
It's a separate program, yes. Yeah.
So how are you assessing the value of the land to determine, the amount that you're going to put into the fund? Like $500,000 isn't a lot when we look at kind of land costs, from my brief understanding.
So there's staff within the Department of Transportation and Infrastructure that would be kind of appraisal-based staff. So
Okay.
as with all land purchases for government, there's a negotiation between the parties. Sometimes there's third-party appraisals that are carried out when there can't be sort of a determination of what the perceived value is. And as with any buy and sell arrangement, a little negotiation happens. And
Charlottetown Belvedere.
Thank you. If there's lots of landowners that kind of line up wanting to get into this program, how are you going to decide? Is it first come, first serve? Given that this looks like it's going to be a pilot, because you're starting with $500,000 this year, and then that's going to be $500,000 each year over 5 years. So is this going to be a matter of like a list is built up and you do when the new money comes in, or perhaps you could speak about the thoughts on that?
It's my understanding, Honourable Member, that it will be in focused areas that now have issues around, climate change and climate mitigation. So, looking at those areas first and the lands that could be purchased there.
Charlottetown Belvedere.
Is there a possibility that it, given, once you get an idea of what that looks like, that this program could be expanded? Like, you've got this initial $500,000, would it be increased if there is significant interest?
Absolutely.
Charlottetown Belvedere.
And is this able to be, I know we're not, it's a sidebar, but the operational expenditure for this, is this something that can be done within the capacity of the department, like bringing in a new program? Is this something that can be done within that existing capacity? Or are you going to need to work with agriculture as well, kind of to manage that?
I suspect there'll be several departments involved. I had mentioned transportation infrastructure. They'll definitely be involved. The staff within this department, and obviously the agriculture, who has the primary relationship with farmers.
Charlottetown Belvedere.
No, thank you. I appreciate that. And obviously, the more complex the programs get, the more likely we're going to have multiple departments across the board. Chair, I have a question about inland as well, just regarding to. We have a target for land protection, and we have a target here for PEI that we should have 7% of our land protected. But we had a story out earlier this year, I think, that said we were at 4.4% by the end of 2020. There's no funding, it appears, in this budget to acquire and designate land as protected. Is that something that is still on the radar? Obviously, this money is specifically for this buffer zone buyback. Where do we see that acquisition cost of land for protection?
So any land purchases goes through the Department of Transportation and Infrastructure.
TIE? Okay.
Charlottetown Belvedere.
No, I'm good, thank you for that. I'll bump that one to my TIE questions. Thank you.
Leader of the Opposition.
Thank you, Chair. I just got this handout, so I'm still going through the buffer zone buyback and restoration program, which I really like the sound of. But I noticed the first bullet point there is to create buffer zones that are at least 50 meters wide. Now, is this 15 meters is where we are with the legislation currently. So are these identified areas in the province where that extra space is required for the health of the stream or waterway?
Yeah, that's my understanding, Honourable Member, is, the really concerning areas of the province are where we're going to focus, and this would be one of the parameters around that. Yeah.
Leader of the Opposition.
Again, it sounds great, and I'm very happy to see this. And obviously, in our exchange and question period today, the idea of government buying up sensitive land and forested land, for example, and many of these buffer zones are forested, is great. 500,000 a year doesn't sound like a lot. I know it's a start, but with the cost of cleared land now, you're probably looking at maybe 100 acres maximum that we would be able to get for that, depending on, obviously it varies, but I see this as 2.5 over 5 years. Are you going to reassess this after, what sort of uptake we get in the first year? I know many programs, if they're fully subscribed and you have a number of people wanting to get involved and can't do so because the pot isn't big enough, will you consider increasing this in subsequent years?
Absolutely. I think that will be something the department looks at on a year-to-year basis, and some years could be more subscribed than others. So, absolutely, we're willing to work with the department to ensure that, the buffer zones we need are there.
Leader of the Opposition.
I'm good, thank you, Chair.
You're
Thanks.
welcome. Charlottetown Winslow.
Thank you, Chair. One quick question. I had this summer a chance to tour the Ellens Creek watershed, and I know that a lot of the streams and rivers, of course, are in rural parts of PEI, but I'm just making sure that there is still a lot of land in District 10 that is being farmed and may lie on streams and rivers, kind of like the Ellens Creek watershed. Is this program able to go through the municipality, or is it the municipality that would be the one that would have to have their own plan?
That's a good question, Honourable Member. I'll see if I can get an answer for that and bring it back. Yeah.
Charlottetown Winslow.
Thank you, Chair.
That's good. Okay. Any further questions? Shall the section carry? Carry. Total land, 500,000 carried. Equipment. Appropriations provided for equipment purchases. Laboratory equipment, 550,000. Field equipment, 200,000. Solar installation. School pilot, 300,000. Corporate land use inventory, 402,600. Leader of the third party.
Can you give us a description of what new equipment are being purchased for $220,000?
Sure. As provided by the department, there's going to be a infrared spectrograph and a somatic cell counter for raw milk analysis.
Leader of the third party.
How many schools will participate in this solar plan?
Sir,
How many schools will participate in it?
there's one pilot project at the Cardigan School.
Which one?
Cardigan.
Cardigan. Okay.
Leader of the third party.
Thank you. That's good now.
Okay. Charlottetown Belvedere.
Thank you. So we've got a pilot happening at Cardigan, which sounds really exciting. How was it determined which school that was the school you were going to start with?
I can't answer that, Honourable Member, but we'll bring it back to you.
Charlottetown Belvedere.
And this is a solar installation. And I believe that Cardigan currently has an oil burner. I just spoke about it the other day, in fact. So is this solar just for electricity generation, or is it also for hot water? Is it like heating, or just for electricity generation?
Honourable Member, it's to bring the school to net zero.
Charlottetown Belvedere.
Okay. So does that mean it's for heating then?
Yes.
Okay. All right. So how long is the pilot going to last? Is this to assess sort of the efficacy of bringing in solar and seeing whether this can be rolled out to other schools?
Yeah, it's to see the efficiency and how it works in this particular school, and then how we can move it forward to make all schools more net zero. Yeah.
Charlottetown Belvedere.
So will we know that after a year, or is this going to need to take longer before we can begin putting these out to other schools?
I would assume that it would, depending on when it's installed and when they start looking at, how well it's doing and space that out. I don't know if they're going to look to it for like over a year term after the solar panels are installed and up and running, but we'll get the information that we have on that and bring it back.
Charlottetown Belvedere.
And I'm hopeful that it is a matter of like a fast turnaround on this, because obviously I've spoken about time as but also the cost right now is only there for 1 year. We don't have a 5-year out span on it. So, it'd be great to see that being, 10 schools the next year or something. So yeah, perhaps if you have any other information you could bring back on that, I would really appreciate it. Other than that, Chair, I think I'm fine for now.
Okay. Charlottetown Victoria Park.
My questions have been answered, Chair. Thank you.
You're welcome. Charlottetown Brighton.
I have a question about the pilot. I'm just wondering, why do you have pilots? This is completely known technology that's installed in millions of square feet, thousands right here in PEI. To my mind, you don't really need pilots. You just need to install them and use them. But why do you need pilots?
Yeah. Honourable Member, I tend to agree with you, but we are starting somewhere, and this is where we're starting. It is a pilot at the first school, and we'll see the costs and I guess the savings. And after we've got a good handle on that, we'll move forward. And I anticipate seeing this line item in the budget every year.
Charlottetown Brighton.
Well, it's great to hear that we're moving forward, so I have no problem with that. But sometimes when you use a pilot, when it's not necessary, it's sounds like a delaying action, if you will. You know, we can't really do anything like until we know the results of the pilot, which shouldn't be the case yet. Thank you.
You're welcome. Leader of the third party.
So why was there no allocation for vehicle spending in 2022, 2023?
That's related to the replacement of the forest fire fighting vehicles.
Okay.
So they are on a replacement plan based on their needs. They did not identify anything for the upcoming year, but have in the next year.
Okay, how are we doing on them? Is it 6?
There's 12 in the fleet, and we've got 4 replaced up to date. There's a couple of fairly specialized pieces, and then there's 2 more, I believe, planned for not next year, but the year after.
Leader of the third party.
All right. And why did the corporate land inventory section not spend even half of the allocated budget for 2021-22? Is this over budgeted, or was there something that just didn't get done?
It's actually a couple of year project. We've had this in from the past, so the project, the first phase went out and kind of gathered the information, and they're at the kind of mapping and digesting of the information. They didn't quite get through that part, so some had to get pushed into the next fiscal year.
Thank you.
Leader of the third party. Okay. Charlottetown, Belvedere.
Just a question regarding the corporate land use inventory. Could you explain what that is? Is this a registry, or is it a database?
Yeah, it is an inventory of land. The inventory has aerial photos, LiDAR digital elevations, ground surveys of more than 800 plots of land. The data is now being analyzed, and they're kind of going to put the results up. Some of the kind of questions they hope to get out of this is how the land use has changed over time. So it's a time series. We'll do this over in periods of time. What's happening with coastal development, what continued areas of risk, and kind of helps inform the planning going forward.
Charlottetown, Belvedere.
Thank you. That's super interesting. Is that like it says corporate land? Is that land that's just owned by the province, or is that land that's owned by other entities? Like, whose land is it that we're inventorying?
Of every inch of PEI.
All of it?
All of it.
Charlottetown, Belvedere.
Even better. Is that data going to be made available to the public?
I suspect so.
Yeah, I can't confirm that, but we'll find out.
Yeah, because
Charlottetown, Belvedere.
Thank you. We have an open data license, which and we've spoken about that in other contexts, and this is a really great example of something that could be also obviously of interest through that open data license. So it would be very interesting, particularly where we look at opportunities, like you mentioned earlier, about sort of restoration activities and so on, how it guides those activities. So yeah, thank you. I'd appreciate further information on that. Thank you, Chair.
You're welcome. Charlottetown, Brighton.
Just back to the cars or vehicles, I assume it includes trucks. And we know that we now have coming online trucks from EV trucks or from several companies. Do you have a commitment for looking into buying electric vehicles in other departments than the school buses? In a case like this, for instance?
So, Honourable Member, this line item is for firefighting vehicles, and there's nothing, in my understanding, that is electric yet for firefighting vehicles, so that the line item here is just for the province's owned firefighting.
I understand. Thank you, Chair. Thank you, Chair.
You're welcome. Charlotte section carry. Total equipment 1,452,600 carried. Capital improvements appropriations provided for capital improvements to the J. Frank Goody Nursery expansion, 500,000. Charlottetown, Belvedere.
Thank you, Chair. Can you just speak to what this investment is for? Like, I know you're saying you're expanding the nursery. What does that actually look like? Or is this what was in the handout?
Yeah, it's 10.
I'm just looking at that again. You're building new greenhouses?
Yeah, 10 new greenhouses with the capacity to produce 135,000 trees per greenhouse.
So this connects, sorry, Chair.
Go ahead.
This connects then to the target of a million trees. When do you expect to have that expansion work completed? What's the kind of time frame?
It's over the next 2 fiscal years. Yeah, this year we're going to have it.
In the current
yeah,
year and the next year.
And the next
so.
year, yeah.
Charlottetown Belvedere.
So you're creating capacity, and that will be online. Okay, and then we're going to see a corresponding operational expense for the trees themselves and the activity around those trees. Will that be done as well?
Yeah, I'm assuming that will come forward in the operating budget.
Charlottetown Belvedere.
Okay, would we also, is there any federal support for this, or is this entirely being done by the province? Because it was one of the targets that we had from the federal government as well, way back in the past election campaign at some point, so.
Well, maybe we'll dig into that and see if there is some matching dollars. We would love to have them.
Charlottetown Belvedere.
$50 Great. Yeah, there was a federal commitment, not necessarily for the greenhouse, but maybe for the trees. So, okay, I'm good, thank you.
Leader of the third party.
Is it going to be 1 million trees this year and next year, or what was the count on the trees that are going to be planted?
Yeah, the commitment is 1 million trees per year, so I'm not sure if we're there yet, but yeah, we are. Yeah. Okay, on November we are there. We're planting 1 million trees a year.
So it'll begin this year? Okay, great, thank you.
Charlottetown Winslow.
The expansion, is it going to be at the physical site, the J. Frank Goody Nursery? Is it at that physical location?
Yes. Yes.
Okay.
Charlottetown Winslow.
No, that's all I want to know. Thank you, Chairman.
You're welcome, Leader of the Opposition.
Thanks, Chair. So I'm reading the note here on the information that was provided earlier. Thank you for that. And in this section, it says, through this plan, an additional 10 greenhouses will be added. Is that this year, or is that 10 in total over last year and this year?
It's over this present year and next year. Yeah. Present fiscal year and next year.
We're going to start putting them up during the current fiscal year and continue it on into the next fiscal year.
Leader of the Opposition.
Just so I'm clear, so it's 10 greenhouses over 2 years, not 20 greenhouses.
10 years.
Okay, great.
10 greenhouses.
Leader of the Opposition.
So, and that's great. And in a recent tour of the Frank Goody site, there's a lot of fantastic work being done there. And it talks here in the handout that we got, that each of those greenhouses will have a capacity to produce 135,000 trees. So you multiply that by 10, and we're well over the 1 million trees that we've been talking about for so long. And of course, that's not taking into account the capacity that we already have. I'm wondering whether you have any details there on what species we're going to be producing, because that's critical if we're going to replace our forests with Acadian forest here. We need beech, we need maple, red oak, we need birch, pine, and all of those things. So is that what we're going to be producing in these greenhouses?
When I kind of reached out for information on this project, they did indicate up to 135,000 trees, depending on the species that they're going to be growing. So I suspect that they will be growing all the species that are required here, and some may take more space than some others. So
sure.
Yeah.
Leader of the Opposition. Okay. Again, on the tour, I noted that if we're creating native species here, of course, they reproduce naturally out in the wild very, very efficiently and effectively. But many of the greenhouses at the Frank Goody site were heated with greenhouse gas producing burners. On these new 10 greenhouses, are we talking about just the infrastructure of the greenhouse itself, or is there a heating element to the capital costs?
I don't have that information, honourable member, but we'll find out and bring it back for sure.
Leader of the Opposition.
Thanks, and I hope the answer to that is no, because it is absolutely possible to, and I understand why they're heated to accelerate certain processes, but given that this project, its primary purpose is to reduce greenhouse gases, the fact that we're burning greenhouse gases to accommodate it and facilitate it is a bit of a, shall we say, an oxymoron. So I hope that entire cost is just for the structure of the greenhouse rather than a heating system for those greenhouses. Thank you, Chair.
You're welcome. Shall the section carry? Total capital improvements, 500,000 carried. Total capital expenditure, environment, energy, and climate action, 2,452,600. Shall it carry? Now moving on to page 13, capital expenditure, finance.
Honourable member, or Honourable Chair, I do have a handout.
Sure.
If I could table that.
You're very
Yeah.
short. So members, there is a handout that will be passed around. I'll give you a moment just to look over it, unless somebody has a question they want to ask right now. Leader of the third party.
Technology assessment management, there hasn't been an increase or a decrease in this line. Is there a reason for that?
Do you know, Roy?
Yeah. There is an increase in this towards the back end of the plan. So if you went into the back of your book, you'd see in years 3, 4, and 5, we're increasing it by $400,000 a year. So they're happy, I guess, as happy as any budget department, receiving departments can be with making sure that they can deliver on replacing the devices with the funds that are within this budget.
Yeah, members, I got a little ahead of myself here. I'm just going to read this section first, and then I'll open the floor to questions. So, equipment, appropriations provided for the information technology optimization and system upgrades. Technology assist management, $1,900,000. Corporate systems upgrades, $8,835,600. Total equipment, $10,735,600. Ty Valley, Sherbrooke.
Thank you, Chair. This is just a general question. I really appreciate the handouts that we're getting, gives us a little more context and really enriches the discussion. I'm wondering if there are other handouts that you have for upcoming sections. Would we be able to just get those now so that we can read them in advance of discussion of those sections instead of waiting for the section?
Honourable member, we can hand out what we've got here. The departments are bringing forward the information to my stranger here.
Sure.
But we do have a handout for health and wellness as well, so I'll table that as well.
Yeah, if we could get that now, that'd be great. Thank you so much. Yeah, appreciate that. That's all. Thank you, Chair.
Okay, and we'll have that distributed. Any other questions on equipment? Charlottetown Belvedere.
Thank you, and again, I appreciate the handout because it does actually address many of the questions that I've had, which is basically what is this for? And I recognise, that recurring annual costs in terms of large capital expenditures in this area are very much sort of status quo because it is that continual, ongoing refresh. As soon as you've got something out there, the next thing's out of date, and you have to continually invest. Are you with the corporate system upgrades? And you've got the update there on the rollout to Microsoft and then the hardware piece. This may come under facilities, so please tell me if it does, but IT systems, hardware systems in particular, are notorious heat sinks. And they're, we know that when you've got those large server spaces and so on, it's one of the areas that hasn't really improved a huge amount compared to some other areas. Is there been a focus on managing those spaces with a view to the cost of heating and ways to sort of mitigate some of that impact?
Yes, Honourable Member, every department now is looking through that lens as far as how we can mitigate, heating costs and carbon emissions. So I thank you for the reminder, and I will go back to the department again just to ensure that they are doing that. But I know it has been brought up in finance before, as it has across all departments. Yeah.
Charlottetown Belvedere.
And again, I appreciate that. I also, it's interesting under technology asset management to see that shift to the 50-50 ratio to more mobile devices. Is that in light of sort of the experiences we've had with COVID and the importance of remote working? Is that reflecting some of that need to be more responsive?
Yeah, absolutely. Yeah, we know the importance now of having that ability to work at home, and part of that is to ensure that we have laptops with all the employees. Yeah.
Charlottetown Belvedere.
No, I think I'm good there for now. Thank you.
Okay. Mr. So the section carry? Charlottetown, Winslow.
Within the software systems, you might know this, you might not. When is the move for the education department hoping to go with to Microsoft?
I don't know the specific date. They're next in line once general government, the government departments get done. They started with rolling this out with, a small test group, obviously, to make sure they get all the kinks worked out. And then they're just progressing through the departments, which that work is nearing completion. And I don't know whether it's the health sector next or the education sector, but all government will be converted. over the next year and a bit.
Charlottetown Winslow.
Thank you, Chair. No, that's good.
Okay, Charlotte section carry. Capital improvements, appropriations provided for capital improvements, facility improvements, 260,000. Total capital improvements, 260,000. Leader of the third party.
Could you explain why this is $100,000 less?
The work for this particular section is really, it's pretty broad to call it a facility. It would be more like a server room within a building that needs to get upgraded. And with the amount of capital construction on the go, the resources that would be upgrading existing buildings are working on new buildings. So I think most of the capital projects have their own budget for this particular type of work. And they just don't foresee the need to get it kind of moving forward at the speed that we had done in the past.
Leader of the third party.
Oh, that's good, Chair. Thank you very much.
You're welcome. Charlotte section carry. Total capital expenditure, finance, 10,995,600. Shall it carry?
Carry.
Now moving on to page 15, capital expenditure, fisheries and communities. Equipment, appropriations provided for equipment purchases, field equipment, 25,000. Total equipment, 25,000. I have a question just on this, and it's just, I noticed that there's no change here in the budget for field equipment, and I just find this a little bit odd, given that the scale of the fishing industry here on Prince Edward Island is so great. So I think it was just last week that the minister stood up and he spoke on the economic impact of the industry, and I just find it, I guess, that the government is only setting aside $25,000 for a, I don't know, almost a $600 million industry here on Prince Edward Island. So was there a request put in for more than that, or is it just 25,000 was the request put in?
That was the request that was put forward through fisheries, and I mean, we all know that fisheries is over a federal responsibility and federal jurisdiction too. So if there is more equipment needed, I would look to the department to submit that request.
Okay, now, so do you know what this field equipment entails? What is the $25,000, what specifically is it for?
Specifically, not on that small scale. They just be what they need throughout the year. It's be a number of small pieces of, like, I think they bought a boat there at one point in time.
Okay. I just, like I said, I go back to it. I just found it odd given the size and the scale of the industry here in Prince Edward Island.
Yeah.
Yes, I know the federal government does regulate in the fishery part of it, but, you know, there is other infrastructure on the island, and I know that, you know, there are many wharves on the island, and yes, they may be, DFO may, or small craft harbors, may have jurisdiction on them, but I do talk, you know, in talking to some fishermen across the island, I know the minister has visited all of them, and he's visited many times in the house, but he's made, you know, some, I guess we wouldn't say promises, but assumptions given to the fishermen that he's going to fix some of their wharves. So I'm just wondering how $25,000 is going to go fixing all the wharves here in Prince Edward Island.
To be fair, the capital budget is for equipment that we own, right? So if we don't own it, we can grant money, but if we don't own it, we can't put it on our books. We can't put it in the capital budget.
And you can't promise money.
I didn't say that.
Anyhow, any other questions on this? Larry and Verness?
So I'm of the understanding we've taken over a few wharves, three wharves maybe, and I know I've been kind of advocating a little bit for the Ellerslie Fishery Station wharf to take that over. Does that lie with fisheries or does it lie with transportation?
If it's government owned, it would be transportation.
So,
Larry and Verness?
So any repairs to those particular wharfs would be through the transportation budget then for a capital expense or fixing up, so i.e. the Ellerslie Fishery Station, if that ever happened, it would be transportation that would deal with, correct?
Larry and Verness.
Okay, thanks, Chair.
You're welcome. Summerside Wilmot.
Thank you, Chair. I had a lot of the same questions that you did, actually, Chair, and I know that you just asked it, but I apologize, Gordon. I wasn't able to hear your answer. I also thought 25,000 was a relatively low number given the importance of this industry, and I was just trying to get a sense of what equipment we are replacing in the capital budget.
Definitely, we have some boats in the fleet within the fisheries, and they did purchase a boat, and they have purchased boats. It would be mostly small equipment. Again, the information that I had provided was we don't own a lot of the assets on the wharf, so it's through the operational budget, you would be providing some grant funding if you were going to help out. If we have to own the asset to be able to have it in the capital budget.
Summerside Wilmot.
Thank you, Chair. I just wouldn't have thought $25,000 would come close to replacing a boat. Is that what I'm hearing you say?
Yeah, it would just be a small, dinghy type with a motor, it's just a, so 25,000 I think would cover that, I remember. And again, this is the budget that was submitted by Fisheries to Finance Department. And for capital improvements, it's for capital purchases and improvements, so it's not operating. So this is the number that was provided to us, and it's remained that number for quite a while. So.
Summerside Wilmot.
Thank you, Chair. No, I understand that that's what they were asking for. I was just trying to get a sense of what capital asset we own.
Yep.
For $25,000. The province has a dinghy, is that what?
Well, any small boat that is motorized would be covered by that $25,000. I don't know. So if that's what they're purchasing, or it could be, I don't know, it could be a drone, it could be, I'm not sure. They didn't give us a list of what they're purchasing. It's a very small amount, and they have the ability to do that purchasing within the department.
Summerside Wilmot.
Thank you, Chair. I was just trying to get a sense of what it is. A drone would be a very interesting purchase, but that's different than a boat. I was just curious what you're planning to buy.
Yeah, I was able to get a little bit of information here in addition to any watercraft. I think the department is looking at a water quality measurement piece of equipment. pH, oxygen, chlorophyll, temperature, and that's what they're going to do for the next year.
Summerside Wilmot.
Thank you, Chair. That makes loads of sense to me. Thank you.
Any further questions? Shall the section carry? Total capital expenditure, fisheries, communities, 25,000. Shall it carry? Page 17, capital expenditure, health and wellness. Equipment appropriations provided for technology upgrades. Technology upgrades, $2,698,400. Total equipment, $2,698,400. Mermaid Stratford.
Thank you, Chair. I again will say I appreciate this because it outlines the two technology upgrades that are planned for 2023, which explains why there's no other capital for technology upgrades after this upcoming year. So I appreciate that. So currently Health and Addictions is on the ISM system. What is the timeline in 2022, 2023 for the rollout of adopting the new solution?
I believe it's supposed to be ready to go by the end of the year, and given that they didn't ask for any money in the following year, that's the assumption that I'm making. Because it's kind of an add-on to the current TELUS solution, they're just going to get into sort of a contract with TELUS for the requisite pieces of architecture that they need to support the community. I believe this system is being used elsewhere, so it'll be a matter of kind of meeting with the users to make sure that what TELUS is proposing will deliver what they need. When you're moving from one system to another, you always have pieces that don't quite look the same, and trying to customize often doesn't work that well. So I would suspect there's a kind of a little bit of a business process redesign for how to use the system and how to roll it out. So, but I expect it within 1 year.
Okay.
Mermaid Stratford.
Thank you, Chair, and thanks for that, Gord. So as any technology rollout, there's always data that needs to be moved into the system, and often dirty data, and it's a time-consuming process. So is it your expectation that all of that moving of data into the new system will be happening under this capital project, or is there operational expenses ongoing that we would see that?
It would be under the capital project. Yep.
Okay, thank you.
Mermaid Stratford.
Thanks, Chair. And how many, so is this just going to be available at the Hillsborough Hospital, or will it be all addiction, mental health services straight across the province?
I believe there'll be upwards of 200 providers, so it's the community mental health side, so it's not the hospital-based, but the community side.
Mermaid Stratford.
And thank you, Chair. And that's all publicly funded community side, or, okay, thank you, Chair.
Mermaid Stratford.
Thanks, Chair. And what about private providers, the psychologists, social workers, and everything that are in the private sector? Will they have access to this system as well eventually? Maybe not the first phase, but eventually?
Remember, we're not sure about that, but we'll find out and bring it back, whatever information we have.
Mermaid Stratford.
Okay, that would be great. We just know when people are working through mental health and addictions issues and they find somebody in the private sector that works for them, it's great when you don't have to keep sharing the same story over and over. So I appreciate that. On the primary care EMR system, $7.6 million in this year. The total project is 9.6, so that's another 3 million, I guess, ish. That's going to be spent next year in the upcoming. Do you have a sense of how that rollout is happening and who is, like, what's the progression and when we're going to see, like, who's going next? Has that been all dealt with and shared with the users?
The project team is definitely working through. I think there was the information would say 186 providers identified at the beginning of the project.
Yeah.
And I think they're through 12, 20, or 22 sites and 41. 12 clinics, sorry, and 41 providers. So they're working their way through.
Mermaid Stratford.
Okay, that's great. I've asked this before, and I'm just wondering, because I know it was not part of the initial rollout, but the patient portal piece, where patients will be able to go in and view their own medical records, is that part of this funding, or is that going to be perceived to be in a different rollout?
I think the Department of Finance through IETSS is looking at a portal for all services, including this one. So rather than kind of just focusing on this one, I think they were kind of trying to do it for all services. So it's in the kind of development stage right now.
Okay.
Mermaid Stratford.
Okay, however, I don't see funding in this 5-year plan to cover that off. Was that under the finance 5-year plan?
Yes, it would be through ITSS. Yeah.
Mermaid Stratford.
A patient or a resident portal where they can go in and see everything, including their medical records.
Yes.
Mermaid Stratford.
Okay. Because I have to stress exactly how important it is that the patients are part of that, because so in a place where we're at right now, where we've got many islanders that don't have access to primary care, and I get we're working towards that, and I get it's going to take time. What that means is that islanders have to be an integral part of their own health care. But if they don't have access, I remember my dad going through treatment. He didn't even get access to blood work. It wasn't going to be provided to him, and that was hard to understand because it's his blood work, right? And so patients having access to their own medical records is so important so that they can be part of their health care. So I really, really would love to know what that plan and rollout is, and to ensure that patients have access to their medical records, some sort of portal where they will be able to access this information, and more detail on that if that's possible, because I can't stress how important that is.
Well, thank you, Honourable Member. The department's for listening, and we'll bring back whatever we have.
That's great. Thank you. I'm good for now, Chair.
You're welcome. Any further questions in this section? Shall it carry? Capital improvements. Appropriations provided for capital improvements. Mental health facilities, $6,333,100. Total capital improvements, $6,333,100. Shall it? Mermaid Stratford?
Yeah. So the mental health facilities, $149.4 million. So let's start with the first thing that's on your list. So structured housing, including day programs, the extended addictions extended care residents. Can you? So I'm seeing that there's 12 women's addictions care residents there. A replacement for the current Lacey House, and a structured housing facility for 8-bed residential capacity, including day programs for 20 daycare spaces. Just reading that into the record so that people understand what this $149 million over 5 years is. Can you break down to me what is actually happening in the first year of this, for this $149 million?
Well, you'll see that what you just read off, the completion of those facilities will be March 2022. I don't have the particular breakdown, but I'm guessing my stranger does, as far as year to year.
Yeah, there's a whole project management office that's kind of tracking the activities, planning activities, and kind of costing the activities. So based on the scope of the work that's included in the current fiscal year, it's construction of the 2 buildings that are mentioned in the first bullet, and it will be the architectural design for the campus, the hospital itself. That process, the tender closed for architectural design. It is being evaluated right now. There was 8 bidders, which is great to see that level of interest in the project, but with 8 bidders comes 8 times the work to get through to select the eventual prime consultant. They expect that work to be done, I think, designed in January 22, so within a couple of months they'll get through, a few weeks now, I guess. 8 weeks, for the next 8 weeks they'll kind of complete the evaluation and get into a contract with the prime consultant. They'll commence their design work, and then the construction expected in 24. So mostly some design work with the architect for the hospital, and the construction work for the first 2 buildings mentioned would be covered by this budget.
Mermaid Stratford.
Okay, thank you for that, Gord. Thank you, Chair. So am I understanding that selection process is going to happen over the next 8 weeks? And
It's ongoing right now.
It's ongoing right now for the next 8 weeks. So by January 2022, we should know who has been awarded the bid?
Oh, they're going to start their work, so once the contract is signed and they work out sort of all the specifics with the eventual proponent, that group will be known for sure.
Okay.
Mermaid Stratford.
Thank you, Chair. I would suspect that's going to be a pretty big of an announcement, won't it, when we finally identify who's going to be doing it, and that's, I guess, the first step to actually see something happening. So I look forward to that announcement. So next year's budget is not as high as the budget was for 2021-2022. So if you can compare, can you tell me what is being either removed from the budget or pushed to the outer years of this budget?
As you can appreciate, with a project of this size, cash flowing is a constant changing dynamic. So again, I rely on the expertise of the project management office to try to set up within any fiscal year the amount of money that they think they need for the activities within that fiscal year. Dropping for 22-23, we're into the design phase only of the hospital, whereas in 21-22, we're in the construction phase of a couple of buildings. So that would kind of highlight the small difference between the years.
Mermaid Stratford.
Great. Thanks, Chair. So just reflective of pushing the actual construction back a year. I've spoken to a number, and I mean, it's not a secret. Construction here in Prince Edward Island is at an ultimate high. And we do see a lot of construction happening in this budget, which, I mean, is needed because subsequent governments prior has not looked after health infrastructure. So are there concerns that, and it's the truth, is it a concern that what you've projected is going to be built in the next year or two would have delays based on the current situation in our construction area?
Oh, absolutely. But once there is an RFP out and someone has been awarded that RFP, it's within a certain time frame, and it's up to that company to ensure that it's completed in that time frame. So.
Sure, and if I could just add, I did have a chance to go and kind of sit with some of the members of the project team, and they are conscious of the activity ongoing on Prince Edward Island. This is a very large capital project. So they are actually monitoring what gets announced, what gets built, what gets awarded, so that they can try to position themselves, and they are positioning themselves with the industry to know what the timetable is, so the industry is well aware of what to expect.
Mermaid Stratford.
Thank you, Chair, and that's all important discussions to be having, so I'm glad that that's happening. I mentioned yesterday in the capital bill for Stratford High School, a publicly available space on the government website that would, after tenders are awarded and that kind of thing, I'm not asking for a prior, but I'm just saying once the project is underway, and you have your project teams working on it, if there is a place on the government website that you could maintain that information so that the public can access it at any point in time to find out where we stand with our capital projects.
I had a conversation this morning with the Department of Education regarding schools as to, I asked them to refer to the information that you had brought up on the Land Matters to see if there was a run of information that they could provide. They didn't tell me no this morning, so, but they didn't tell me yes either, so it would be something that I think that they're hearing that some of the public-facing information that should be available or could be available either is something that they're thinking about.
Mermaid Stratford.
Okay, I love to hear that because I have to be honest, being able to read those committee minutes to see like where challenges were or what's coming up next or what stage we're moving into, that just takes, it gives Islanders the knowledge of where their money's being spent and how it's progressing, and it's just, it's a good step. Like, it's just a transparent, good step to take. So I love that you didn't get a no, and I think that, and I said this to the Minister of Agriculture and Land yesterday, I do believe that the Land Matters PEI project actually set a standard that government should be trying to achieve for all of their projects. And I thank the Minister of Agriculture and Land and his department, and I recognize that, you know, there is a big policy team within that department that allows them to do that. But I think that just the awareness that the public had as to how much work government was doing is only going to benefit government. And it will also benefit Islanders, because then they can hold government accountable too. But they have the right to do that because it's their money. So just a quick question on new builds. Something that happened after our budget submission went in was the closure of Sherwood Home. And Sherwood Home wasn't on my radar. I don't know whose radar it was on. It was actually the closure. I believe there was 12 beds available there. They were moved into the PE home. And this is really, I mean, there are residents that were not able to live at home with their families, but there was also respite services that were available at Sherwood Home. And now they've been moved to a different location. Restorative care beds, I believe, has been taken out of the system. So is there a plan to replace Sherwood Home now that it's closed?
There's not a plan in this 5-year window that you know has been brought forward to us. So it would be a question, you know, you could ask the department, you know, where they're at with that. It's not in the capital budget in this 5-year plan.
Mermaid Stratford.
Thank you, Chair. So what will happen to Sherwood Home? Is that going to be torn down, or is it going to be refurbished into something else?
That would be a question directed to transportation.
Yeah. Similar to any government, I provided this answer yesterday for the Sherwood School. Once a building is declared surplus by any particular agency or entity, it gets turned back over to transportation infrastructure for the eventual determination of what it will be used for, or whether it be ultimately torn down.
Mermaid Stratford.
Okay, thank you. So when will Lacey House and the community facility be completed and accepting?
on here, March 2022.
March 2022?
Yeah.
Okay, thank you. And what about the third building? I'm not sure the name of it. It's not the hospital, but it's the third building that was prioritized.
Yep, it's the 4th bullet in your handout there, the Addictions Transition and ALC Residential Facility.
Okay, thank you. And so I just received this, so bear with me. Again, the new Addictions Transition ALC programs will be co-located on the Hillsborough campus, adjacent to the new hospital. So 12 addiction beds. Will the Hillsborough, not the Hillsborough, Mount Herbert beds remain open, and this is 12 net new beds for treatment?
We'll have to bring that back. That's not a discussion we've had for capital budget purposes.
Remain Stratford.
Okay. Would see that as a really good capital budget question because it talks to your return on investment, and if you're, how many net new beds you're creating is really speaking to how you spend capital dollars, right?
Well, the conclusion is for September of 2024 for this particular building. So I think in the meantime that there will be discussion, but it's not something that's been brought forward for the capital budget of this year anyway.
Remain Stratford.
So the next is the 12 alternative level of care client beds. Is this just, so the ALC beds, this is an issue of many people are staying in the hospital, in hospital beds because there is not enough access to ALC beds. So, excuse me, I can't clear my throat, so I apologize. How will those, so those will be open again, not until 2024? Okay. So we've talked about a number of facilities. Have you been briefed on the recruitment intentions of how we're going to fill these facilities for launch day? Because, I mean, the last thing we want to see, obviously, is empty hospitals because we don't have staffing that can manage it. So did you receive a recruitment plan in order to match up and marry up to the construction of these buildings?
No, Honourable Member, I have not. It's not something that's really in my purview for capital budget. I understand the importance of doing that, but it would be more, I think, an operational budget issue, even though we are providing more spaces. It looks like we're providing more spaces unless we decide to close, but I think it's a kind of evolving process because we know we have shortages across healthcare, so we want Islanders to have the very best care they can, and there has been a commitment over a number of years now to ensure that we have this mental health campus up and running and that we can attract new employees to this who will be attracted by the fact that it is a new mental health campus. So as the finance minister on the floor for the capital budget, that's not a discussion that was had.
Okay.
Remain Stratford.
Okay, I appreciate that. Thank you. So design is expected to commence January 2022 for this building, and construction is expected to start April 23rd and end in September 2024. I can't tell you how much I appreciate this sheet. So thank you very much. Thank you to the Department of Health and Wellness for preparing it, because this takes so many questions off the floor, and Gord, it actually takes you out of the hot seat. So I can't stress enough to the departments coming that when we have a public servant who has been gracious enough to answer the endless questions that we've had for the last 3 days on the capital budget, the respect that it shows you when departments provide this information in advance to us. So thank you, Gord, for everything that you've done in the last week, because I know that that has not been a very comfortable seat.
Carry the budget.
I will ask now, that was my last question, but I do know that we are approaching health PEI. And do you have the handouts for health PEI prior to us getting in there, or is Gord back in the hot seat
Honourable
again?
Member, we'll wait until we get to that section, unless she wants to table them before. So do you have any further questions regarding this section?
I don't, no.
Okay, High Valley Sherbrooke.
One of the requests that we had in our submission on the capital budget was around the expansion of detox facilities. We know that there are long wait times for detox treatment, up to 3 weeks or perhaps more in many cases. And the response was that there wouldn't be any additional investment. And I wanted to just make sure I understood that and why that would be.
Do you have any information? Honourable member, we can't really talk to that right now. We don't have the information, but we'll be happy to bring back what we can.
Yeah.
Minister, would you like to just take this opportunity to table that document?
Absolutely. Table information regarding health PEI.
Great, I just want to have that as an answer. Tyne Valley Sherbrooke?
Thank you. Sorry, did you say you're sharing some information on the section for health PEI as well? Did I just catch that or no? Sorry.
Yes, it's coming.
It's coming. Okay, good. So, because this is one area where there's actually, it actually matters what's in the health PEI section as well. So when I asked about detox centers before, the minister had mentioned that there may be some overlap with detox treatment and other mental health and addictions treatment in the new medical homes and medical communities, which that sounds very interesting. But the problem with us debating these capital expenditures now without having the full plan or any sort of plan around what those neighborhoods and homes look like is that I don't really understand what. We have no way of knowing what the goals are of each of those locations and what services are going to be provided there. So we can't really assess what capital investments need to take place in those locations. So I find that really unfortunate. I know that it's been said in the media that there will be a roadmap for healthcare or something to that effect. I believe I may have the wrong name, but released in November around this. Is there any information that you can share with us now, or that has been provided to you, I guess, about what those medical homes and medical neighborhoods are all about exactly, so we can assess for the capital budget. There are implications for the capital budget in terms of what additional spending might need to be done in terms of facilities and other equipment and whatnot. So do we have anything? Because it does overlap here with mental health and addictions.
Yes, Honourable Member, if you look to the handout that we gave, the fourth bullet is about the addictions transition and the ALC residential facility. So there is that part, and that's where we're on right now. There'll also be more information for through health PEI, the next section. As far as the operational plan, that's not really the purview of the capital budget. We are looking at the bricks and mortar of government and the infrastructure that's being provided.
Tyne Valley Sherbrooke.
I guess in this case, though, it really does matter, though, right? Because you can't, we're talking about an entirely new envisioning of what our healthcare system is going to look like, right? This is what we're told again and again, and I think that's very interesting. And as was noted, there could be some real positive potential in that. But to make decisions about the bricks and mortar, components of that without that information it's quite challenging, and I realize that it's you have to go with what you're given, but I would imagine that you were provided with information about what those centers all, what those community homes and what the medical homes and communities are all, what they look like, what they involve, so that you can make a good decision about what investments are needed in them, capital investments, right? So I guess I have a hard time even, passing this section as it is, because there is such an interaction between those medical homes and medical communities and our mental health and addiction services. This is what I've been told. We can looking up at, in Hansard from, last May, that there would be mental health and addiction services would be interwoven in many cases with those community homes and medical homes and medical communities. And, it's not necessarily a bad thing, but I don't know how to assess whether or not the capital investments are sufficient or needed or the most appropriate without that plan. So that's the struggle for me. That's all, I guess, for now, Chair. Thank you.
Mermaid Stratford.
Thank you, Chair. Surprised not on the list. Okay, so I would like to talk, in our submission, there was a request for childcare facilities near or within the hospital, so QEH, PCH, what have you. It's really the number one thing that I hear from women who work in healthcare. So when you hear from a nurse, for instance, who's been asked to put in 3 extra hours to cover off when somebody can't make it, but yet her childcare closes at 5:30. So our request was to have something located in the healthcare facility or very close that had extended hours. And I'm just reading that the response, the note in the memo as to why it's not being funded is childcare facilities receive grants from the operating budget. Facility owners could approach the Department of Education and Lifelong Learning to expand through their recently signed provincial Canada-wide learning childcare agreement. The challenge is, I guess, was there a question to Health PEI at the QEH if there was room? Because if you don't have space, you need bricks and mortar. That's what the capital budget's about. So was there even a discussion that happened between deciding on what was going to be funded through Treasury Board and the primary acute care areas that we were hoping that childcare would be located, to even discuss the fact that you might be able to build space for it?
Yeah, it's to date, the model for providing childcare in PEI has been exclusively a private model. We really don't operate childcare spaces. We're not in competition with childcare facilities. We do that work, I believe, through grants, through early year centers, and some grants as well to private centers. So when we kind of put that question to the Department of Education, they obviously are hearing the same kind of questions come. Space is expensive and at a premium at the QEH right now, so it's unlikely that they could clear enough space to run an adequate daycare within the footprint of the existing Queen Elizabeth Hospital. So I guess the next round of discussions is there space in some area out there to consider building something that, whether it would be leased out to somebody to run a daycare or where government owns it. But I think with the new kind of funding announcement through the investment in childcare, I suspect those sorts of conversations will happen.
And
Sorry.
Honorable member, there are discussions right now with the PCH to provide that service there, and I know the employees are very keen to have that, and I can tell you from a previous life that I'm a big proponent of that. Was able to get a daycare in Belfast, the Early Learning Centre, and it was at the Gillis Lodge initially until COVID. So I'm well aware of the issue and the need, and I applaud the minister who is working on that. And if there are constituents that you have that are concerned, and I would say bring it to your supervisor and feed it up the chain, because I think it's really important, and it has to be an initiative that I think is done sort of grassroots and comes from there. But it's very important to provide that childcare, and especially with healthcare, especially where we are today. So it's not a discussion that I had with the department. That would have been an internal discussion that they had. And if there is an opportunity, they should reach out, maybe have a conversation with Chances or any other provider, and go from there.
Mermaid Stratford.
Great, thank you, Chair. And I completely agree with all that, and I love to hear that that's what's happening. Those discussions are happening at PCH. I'm trying to keep my earpiece in. And it goes broader than that, because as you are aware, we have to have people working at our facilities 24/7. So when you don't have, let's take, for instance, a single parent who is a registered nurse, who then is challenged with taking on shifts because he or she needs to work overnight, right? So that's the thought about having on-site daycare within our acute care facilities. Because think of the quality of life of that. So you're off on your lunch break, and you can go pick up your child, and you can go have lunch with your child and spend an hour with them. And you think about what that does to the family unit and the work-life balance. You think about when, like, potentially if there is the ability for the child to have sleepovers in the daycare because their parent is working an overnight shift, at least then the parent knows that they have childcare and they can be more apt to take those shifts. I was recently speaking with an RCW who thought that that their family unit was understood when they were applying for the role, but then they weren't hired because they're unable to work certain shifts because they don't have childcare. So I understand that this budget is about the bricks and mortar. We've just discussed QEH does not have the space. I'm not sure if there's space in the general facility, but having on-site childcare for somebody who is working in our healthcare facilities is huge, and one of the biggest things that we hear why people are leaving the profession. So if we can change that narrative and if we can change that story to tell them that yes, their families matter too, I think that would be I think that would be one of the biggest changes that you could make within healthcare services to ensure retention for our frontline healthcare workers.
Honourable Member, not a new issue for me, and something that I have been advocating now for a long, long time, and I will continue to do that, and maybe through the Hospital Foundation or through WOHELO or one of those groups that do fundraising, there could be a project that they take on. You really need to have people on the ground who are willing to take it on, because it's a big job.
Okay.
Member Stratford?
I appreciate that, but you also still need the bricks and mortar, so you need to have it in a capital plan, because nobody can take that on if they don't have a commitment that the government's actually going to support the capital build for it. So another thing, sorry, let me switch here. Another thing that we had put into our request was for expansion of shelter service facilities, and we know that is that in, no, that's not in this section, that's in social development and housing. QEH restorative care unit, and increasing the beds there. So my understanding is Health PEI is currently discussing options for this service. However, more work will be needed before a capital expenditure is planned. Did you get feedback back as to how many restorative care beds would be required in order to help our hospitals better function, so that people who are medically discharged have a place to go because they're not ready to go home? So did you get a sense from Health PEI when you were having this discussion with them that you're not ready to fund it, as to how many people it would actually support?
No, Honourable Member, that would be something that would be discussed internally through Health PEI and Health and Wellness, and the line items they bring forward is what we look at, and that's already a discussion that's been had within the department.
Member Stratford?
Okay, I'm just going to go back to this memo again, and I know that my colleague talked about the expansion for detox facilities already, which was another thing that wasn't funded. I'm going to ask about the funding for the Kings County Memorial Hospital. When does that money start?
That's through Health PEI.
That'll be the next section.
That'll be in the next section. I'm good right now, then. Thanks, Chair.
Shall the section carry?
Carried.
Total capital expenditure, health and wellness, $9,031,500. Shall it carry? We're now on page 19, capital expenditure, health PEI, equipment, appropriations provided for the purchase of hospital equipment. Hospital equipment, $20,824,800. Total equipment, $20,824,800. Mermaid Stratford.
Chair. So for the QEH Equipment Drive Foundation supported, can you tell me what the split is of, like, what does the province pay for equipment versus what the foundation fundraises for?
Yeah, the foundation would take on a lot of the small and medium sort of purchases that go on out at the hospital. You see there's a couple of dedicated line items for linear accelerators and PAC systems and things like that, but they do come up with an area of priority based on discussions with the hospital. They set their capital campaign forward. Government has provided funding to that capital campaign to sort of assist them with their fundraising goals. When that particular run of equipment, whatever happens to be on the list in any particular year, it gets back on and into the assets of Health PEI.
Mermaid Stratford.
Okay, thank you, Chair. So this $6 million that's estimated for 2023, just clarify for me again, Gord, is that actual funding from the province, or what is?
Well, it'd be through their annual equipment drive and all the fundraising activities that they carry out throughout the year, of which the province has been a contributor to that program.
Okay.
Mermaid Stratford.
Okay, thank you for that. Chair, was there anything on this list that was originally on the Health PI list requesting funding for that was not accommodated from the Department of Finance? Is there anything that was pushed?
No, this particular line item is kind of worked out between the foundation and the hospital based on their ability to fundraise and the needs at the hospitals.
Mermaid Stratford.
Okay, thank you, Chair. The Interray home care, the $1.6 million for Interray, and I apologize because I obviously haven't read this, right?
Sure. And
because I got it about 15, less than that, and I've been talking ever since, so, which I do a good job of. I have to say I can talk, but, or at least I've been told that, but anyway. So the Interray assessment system, will that be rolled out to all home care, like anybody who's working in home care?
Home care and long-term care.
Mermaid Stratford.
It's an assessment tool.
Okay. Chair, I'm going to let somebody else go.
Sure.
And I'm
O'Leary and Verness.
As I got this handout with issues around appropriation for hospital equipment, I don't see anything on there for Community Hospital in O'Leary. Now, myself and the minister had a meeting with the Hospital Foundation, and they had talked about doing some fundraising for an ultrasound machine. And the minister made a commitment that he would even mention the government support equipment drives and things of that nature, although may not have specifically said that they would fund that. I don't see it on anything on any list here, so I'm just kind of wondering, is that on any other list? That because I don't think an ultrasound machine is massively expensive. Like, I don't think it's in the hundreds of thousands of dollars. So,
yeah, I'll have to bring that back. You're right. I don't see where other hospital equipment is located in this listing of information.
yeah, and are you? Oh, sorry, Chair.
You go ahead.
Is there any purchases of equipment at Community Hospital in Larry that the government will be supporting on any list other than the?
I did mention that the government has provided to the QEH, it provided to the PCH, it provided funding to all community hospitals.
Right. Yeah.
So again, what is needed on the ground would be worked out with the particular hospital and the foundation. I just can't see where we're recording those purchases for the community hospitals, and I apologize for that.
O'Leary and Verness.
Okay, no, and then, like I say, and I do understand as a former minister, and this was that, there's big purchases, and we purchase them through government, and then the foundation provides us some of the money back, and that makes perfect sense. And I do also understand smaller types of purchases kind of is reverse. But anyway, just that would be one section that I would look for some information back. Thanks, Chair.
You're welcome. Mermaid Stratford.
Thanks, Chair. And so when I look through this, there's a lot of new systems, a lot of integration with technology, and even with the electronic medical records. But I guess my question is the appropriate level of staffing trained? Are they available within Health PEI to work with the new equipment, or is there other requirements there?
I guess that would be ongoing. you know, as they move forward with, you know, with every iteration of this, there would be ongoing training.
If you wanted to pick a particular piece of equipment, let's say they're talking about upgrades for the linear accelerator. So part of the particular package it would be training for the staff to make sure that they're aware of the features and how to operate the system appropriately before it goes in service.
Mermaid Stratford?
Great, thanks, Chair. And is that training part of the capital expenditure, or is that an operational cost?
Definitely ongoing training is an operational cost, but there would be training that would be included in the initial setup. So the vendor would be on site training the particular staff with the intricacies of their particular equipment before it goes in service.
It'd be part of the RFP,
Part of the
assuming
whole
through
package
the
of
package,
costs.
yeah.
Okay.
Mermaid Stratford?
Thank you, Chair. And so, like, when we're looking at the assessment system and when we're looking at the Cerner-based solution, those types of things, those are all programs like technologies that I'm wondering, are they compatible with being rolled into the EMR in the TELUS-based solution? Is that something that will all work together so that we're not operating in such a fragmented electronic medical record system as we are today?
Yeah, the hospitals use the Cerner-based information system, and the community is using the TELUS. So that was one of the concerns, obviously, that you can have two systems that kind of talk to one another, and I understand that there is some interplay between the community-based system and, let's say, the lab system that's going to be in place out at the hospital, that information can flow.
Mermaid Stratford?
Oh, I missed your last word there. That information
Can flow.
can flow. Okay. All right. I'm good. Thanks, Chair.
You're welcome. Charlotte Section Carey?
Carrie.
Honorable members, we're just going to take a brief break here, and we'll be back in just a few minutes.
Slave driver.
We are now back in session. Again, we are on page, I need to get my glasses on, 19, Health PEI, capital improvements. Appropriations provided for capital improvements. Health facilities, $30,329,800. Capital repairs, $3 million. Total capital improvements, $33,329,800. O'Leary and Verness.
Once again, at the meeting with the Hospital Foundation in O'Leary, we talked a little bit about the needs for improvement around the space within the hospital in O'Leary. There was talk about an ambulance bay improvement, once again, space for childcare, or just overall space that they were requiring at that hospital. And once again, the minister mentioned he would work on that on their behalf. And so I was assuming, once again, we'd be talking about plans for engineering or funds for that over the next fiscal year. Is there anything on any of that?
There's nothing in this 5-year window for O'Leary.
O'Leary and Verness.
Okay. Okay, then the other, on this section here, we see some information that I find rather interesting when it comes to the medical homes. You've got $63 million over 5 years. And on these medical homes, it says in the west, there's one under for construction, $8 million, and it says building expected to begin April 2022 with occupancy September 23. As I recall in a question I asked the Premier here, he had mentioned that these medical homes would be up and operational by the end of the fiscal year. And I don't know how that's possible when you've got dates of that the occupancy is not expected to open. So can I shed some light and explanation on this? Because it's all the facilities is November 24, March 24, April 24. That's well beyond even next government's timeline. So is there, Minister, is there any?
These are constructed facilities. I think there's one being planned in the Charlottetown area that's going to be a lease fit up that will be online a little bit quicker. I see that it's not on this list, but we can bring back the specifics for the leased space in the Charlottetown area.
O'Leary and Verness.
Now, once again, from questions in the House, we talked about, the Minister mentioned 5 sites, 5 medical homes in the province. Like I say, we do see 4 there, and you're saying one may be in Charlottetown, so I'm assuming that's in an existing facility. But once again, I see none of them that have any dates that would have these opened anywhere near the fiscal year, and I would even find it hard to believe that you could fit up an existing facility by the end of the fiscal year. So I'm sure, Minister, you can appreciate where the confusion comes in these medical homes when I've got ministers saying one thing, a Premier saying another thing, and we got a capital budget that's saying another thing, and they all contradict one another. And you know, it's a challenge for me as a member of the House when I'm trying to support a capital budget here when we get these kinds of discrepancies. So, I mean, I'll have to take that nobody is trying to make it confusing. It seems to be that they are, but as a listener, when we have that many dates different, so I'll have to assume that we're going to be setting up some sort of a temporary facility by the end of the fiscal year in some of these existing sites or something around that nature. And like I said, I've also have said that I don't know how you staff these sites, because I've been told that these sites are going to be staffed by additional people, nobody's taken from existing positions. They might reassign a person and, take and consolidate that, which I have no problem with that. So Minister, you're the minister responsible for the funding, the financial component of these facilities in the capital budget. Have you talked to the Premier to say, we can't do these quick, why are you saying this? Or give me some sense of where the discrepancy and confusion comes from.
Well, Honourable Member, all I can do is tell you that these are the numbers that are put forward, and we'll work with the department to ensure that we have the medical homes that we need up and running within a time frame that's listed here. That's all I can tell you.
O'Leary and Verness.
But that's in contradiction to your minister and your Premier.
Well, Honourable Member,
I don't get me wrong. I think your numbers and your scheduling makes far more sense. But it's not to what I'm getting from when I ask questions in this legislature.
The numbers that we have are put forward by the department, so that's all I can say. It's a discussion we're having ongoing, and we know the challenges around healthcare across the country. It's not just Prince Edward Island, it's across the country, and we'll work with the department to make sure that fiscally they remain within the parameters that are listed here, and work with the Premier to ensure that we have those medical homes up and running.
O'Leary Inverness.
But therein lies part of the issue. Like I say, you can build the bricks and mortar, you can put the facilities here. I mean, there's some other members have asked questions. Is there a HR strategy to follow building these buildings? So, like I say, it's not the hardest thing in the world to build a building, but it is to staff them, and it is to make them operational, it is to try to make them, but when people are saying that these are new positions, it's going to be new facilities and providing new services. And we don't seem to have a HR strategy that follows that, and or the likelihood, like you just said, that it's hard everywhere to find staff. So as a minister, you have to look at, is this a prudent way to spend money in a capital budget when you can build a building but you can't staff it? I mean, we've got that now.
Well, Honourable Member, there is no silver bullet for that. For this, we know it. You knew it when you were minister. The announcement for the medical school at UPEI is all part and parcel of this. It will attract medical professionals here. We will work across all departments to do what we can to ensure we have the staffing that is needed. It is a challenge, there's no doubt about it. Honourable Member mentioned childcare. We know that that's definitely a needed and very valuable asset, but again, staffing for childcare. So, there are a number of challenges. We know that we have a shortage in the workforce across the board, and we're working through that through immigration, and then that brings on the problem of housing. So it's a domino effect, and we're working across government departments to ensure that we can provide the very best care we can for Islanders.
O'Leary Inverness.
I'll just leave with the statement. I understand governance is not easy, so I empathize with you in that regard. But once again, the same criticisms were thrown back at me and us, and we didn't do enough. So I mean, it's part of what you have to deal with, right, in governance. So.
Absolutely.
Anyway, thanks, Chair.
You're welcome. Mermaid Stratford.
Oh, thank you, Chair. Can you tell me what the nurse call replacement is? That is the $2.76 million.
And nurse call would be the system between the rooms and the stations, or the kind of the area where the
Call bells.
Call bells, yeah.
Mermaid Stratford.
Okay, thank you. I am going to touch on the medical homes. So presumably by the end of the year, that's by the end of the fiscal year, so that's March 31st is when this, the timeline on the medical homes. Is that what I heard? Is that correct?
Well, we have on here a new site listed as well, so that would not be included in, the end of the fiscal year for sure.
Okay.
Mermaid Stratford.
Thank you, Chair. So the medical home east, presumably there's a location chosen for that? Whereabouts is that going to be?
Location, they're working with, trying to get a lease space for that to get it fit out.
Mermaid Stratford.
Thanks, Chair, but do you know where? Like, have they narrowed it down to like 3 options, or are they in negotiations for the space?
I think it would depend on what space is available, and the department is looking at that as we speak, I'm assuming, yeah.
Mermaid Stratford.
Okay, and so you've got $3 million listed. What was what were the factors that were provided to you to identify that it would be $3 million if you don't have a space identified yet?
They do a determination on what they believe the amount of square footage that would be required, and they have a number that they're working off of on a per square foot based on a similar project they would have carried out in their fit up of other health facilities. So it's, again, they're working with the Department of Transportation and Infrastructure, looking at the current cost of what building materials and equipment and the processes that need to go in a particular space, kind of have laid out a footprint of such cost of that space, and then kind of put it in a progression of years to make sure that the funds are there to operationalize it.
Mermaid Stratford.
Okay, thank you, Chair. So when I spoke to Dr. Gardner about this, and space was
a big concern. If we're going to spin up medical homes, then where we're going to home them is, you know, the number one thing that we have to identify sooner than later. So in the east, for $3 million, have we even identified where a location would be optimal? I know, like, when we went through this with the Stratford School, like, they had a company come in who identified 5 potential locations. They ranked those locations as to which would be the best on a whole scale of points, and then they identified which would be the optimal space that met the requirements of transportation and Department of Education. And the town of Stratford was put through a lot of hoops in order to identify the land that school was going to go on. I would certainly think that that kind of analysis is also happening right now. Can you confirm with me that we are, like, what analysis is happening in order to identify the location?
We'll have to bring it back.
Mermaid Stratford?
Okay. I'm just going to point out, I mean, 2022, 2023, that's not very far away. And we're hearing that, you know, these are going to be spun up pretty quickly. But when we spoke with Dr. Gardam about this, it's not easy to find a place that would be retrofitted into a clinical space that's just idly sitting vacant for Health PEI to say, yeah, I'll take that one, right? So if this is bricks and mortar that you have to do in order to put one in the east, that's a whole other thing that we need to be discussing, right? Because of the timelines there and the availability to construction crews to be able to do that work. So that selection process, I would have to think, is underway, and I'm wondering why it's not being shared, or what stage we're at, and why we aren't sharing that with the public right now.
Honourable Member, we said we'd bring back whatever we can on that.
Mermaid Stratford?
Okay, so I'm gonna ask about I'll ask about Summerside. So $10 million, presumably that is a new location. $10 million would be bricks and mortar, correct? Do we have the land for this bricks and mortar project?
I believe the Health PEI has been working, and the Department of Transportation and Infrastructure have been working with the City of Summerside to secure the particular site for this. Initially, there's a little bit of the City of Summerside was initially going to build this building for us, and we were going to fit it up, and we have determined that it'll be better served for government to build that building, so they're still partnering with us in the securing of the land. And when that site is selected, I suspect it will be announced. But I believe there's been discussions along the lines that you're talking about, the merits of what particular sites and where it should go for this particular project.
Mermaid Stratford.
Okay, thanks, Chair. And again, I know from the process of trying to find the land for the community campus in Stratford, there's a lot of things that the municipality has to go through, including zoning, right? And going through that whole rezoning process. So is within the next fiscal year a legitimate estimate in order to have this building open to the public?
Remember, the money that's been allocated is for that project, and it might not happen within this fiscal year totally, but we want to ensure that we do have the funds there to move it forward to whatever point we can get it to, working with the City of Summerside.
Okay.
Mermaid Stratford?
Thank you, Chair. And I just point out, like, the last time that we had this conversation, we said the answer was, well, there's nothing in the next year, so yes, it's going to be delivered. So I certainly hope it's going to be delivered, because that's what the promise would be. So the medical home for Queens County leasehold improvements, presumably if it's leasehold improvements, that location is selected now?
It would be the same discussion as Montague, that they're probably working on it, but we can bring back information as to where they're at.
Mermaid
Okay.
Stratford?
Thank you. So the medical home in the east is going to be in Montague?
That area.
that area,
in that area, okay.
Three Rivers area.
Yeah, Three Rivers. We're supposed to use that term, I guess, now.
Member
Okay.
Stratford?
Medical home for Queens County, new site, 798,000, so that does not sound like bricks and mortar, that sounds like retrofitting something that's already existing. Medical home, Queens County, new site for $798,000.
Yeah, no, that would be for the construction of a building within the Queens County area.
Okay.
Member Stratford?
Thank you, Chair. So it's a significant difference, right? The 798,000 versus 3.5 million. What's driving the difference between those two locations?
Just be planning, pretty much.
Yep.
Yeah, that would just be the initial planning and beginning the process for that build. So that's the amount allocated for 22-23.
Member Stratford?
Thanks, Chair. What's the allocated amount for subsequent years to complete that build?
23-24 is 10,867,000, and 24-25 is 9,276,000.
All right, that sounds, thank you, I appreciate that.
Member Stratford?
Thank you, Chair. So, I
Member
might have,
Stratford, if you're moving off to a different thread, I can move on to someone else. I have a few on the list, and I can come back to
yeah,
you if you
let's
want.
do that. Yeah, absolutely.
Perfect, thank you. Charlottetown West Royalty.
Thank you, Chair. Just under the handout you gave, I just want to focus a little bit more on the medical homes in Queen County, and then it's one that says new facility. Can you tell me a little bit more about that? I mean, I'm not quite getting the answers I need for those. Like, what, is it in Charlottetown?
I don't believe the site has been determined.
It says new site, and the 798,000 is just to begin the planning stages and get to where we need to be, as I just mentioned to the honorable member.
Yeah.
Yeah.
Charlottetown West Royalty.
I heard the answers. I'm just confused about it. So it's just a new site. We don't know where it is. What's the process like, the identification of the property? Like, what is that? The first thing to do or the second thing? Like, whereabouts is it? Just want to say, where is it going?
Generally, with any kind of capital project, the budget's determined, the scope and the size of the building's kind of determined. They determine how large a site they need, and then they start kind of plotting out where that particular site may be. They'd have to work with what current parcels are zoned appropriately for the particular site, and then they'd be looking at access and location.
Charlottetown West Royalty.
So the medical homes, Queens County, the leasehold improvements. Is that, are we talking about the same? Because they're two different areas. Are we talking, what is that? What's the difference there?
That's a second site that we will be leasing through the province, and that would be the fit-up for actually putting the medical home at that location.
Charlottetown West Royalty.
So separate.
So does that mean Queens County is getting two?
Yes.
Charlottetown West Royalty.
It's a big, but there's no idea about. I guess what I'm struggling with is I look at this. I mean, this was announced February 21, and we look at it 8 months ago, and I just wrote down 5 W's: what, who, when, where, and why, and I can't answer any of them. You know, and in the speech from the throne, it talks about this is an evolutionary process. I mean, and the creation of, well, there was, in the speech from the throne, it was 3 new places. I just don't know about if I'm getting the information on this. Okay, and then, so I'll just move on back to my head around it. The Beech Grove home, there's the roof replacement. I see there's 2 lines there, Beech Grove and Wedgwood Manor. Can you give me some more information about the Beech Grove replacement?
That particular project was identified with a list of the COVID resiliency funds, and there was a big push on it last year when the federal government had kind of put a December, my year's mixed up, but a December 21, I believe, to have those projects completed. So, but they extended that for one more year, so this is back in this list. And it's just a partial roof replacement. They do it pieces at a time to make sure the whole roof doesn't fail at once and it doesn't kind of need to be replaced all at once.
Charlottetown West Royalty.
Well, it's good to know we're getting federal dollars to help replace that. Do you have a breakdown of?
Again, there has been a whole list of projects that was submitted under that particular program. I think this is one of them. I'd have to go and get a specific. If it is, they're 80-cent dollars for the portion of the project.
Good. Charlottetown West Royalty.
Saying that the medical homes, is there been federal dollars associated with any of that?
No.
Charlottetown West Royalty.
Is there any consideration to having these homes on bus routes, or when they get operational, is it going to be like a drop-in type? It's a little bit too tough. Drop-in like facility.
I don't think that that's been determined. I can't speak to that as the finance minister. Whether they're on a bus route or not would depend on where our leased buildings are available. I think that would all be part of the consideration through Health PEI to make sure that they are as accessible as possible for Islanders.
Charlottetown West Royalty.
And just my last question are if this is the direction we're taking, the people in Queens County is there's lots of population in Queens County, and they're asking these type of questions about how the service is going to be provided to them, and they care deeply about this issue. So I'll be following up. Thank you, Minister.
Thank you.
Summerside Wilmot.
Thank you, Chair. I was just hoping to ask a few questions about the Summerside Medical Home. I know the conversation around a new build in Summerside started maybe a year and a half ago, when at the time it was the Transportation Minister and now it's the Minister for Energy, Environment and Climate Action had come up to see the space that the Harborside Medical Center is being housed in, and he agreed that it was woefully inadequate. So I'm curious, I heard in the speech that you had made a few days ago that this particular unit will house the provincial geriatric program and a few other things. So I'm assuming that this new build, this medical home, is also the same replacement building for the Harborside Medical Center? Is it one and the same?
Yes, Honourable Member, it is.
Summerside Wilmot.
Thank you, Chair. So I was curious if you're imagining that it's going to have an increased capacity, because the Summerside Medical Center, the Harborside, Medical Center is already operating as a collaborative practice where they have a number of different things being offered in the same space, and you are not a patient of one particular doctor, but you are a patient of the center. If they just move their practice to another location, that's a wonderful thing. They deserve a new location, but it won't take any patients off of the registry that we have currently. I'm just curious if the plan for this is going to expand the capacity of it and bring in additional doctors and professionals so that there would be an increased capacity, or if this is essentially a replacement of the facility we have now.
I don't have any of that information in front of me. I'm not sure if my stranger does, but.
Yeah, no, I don't have any specifics on what programming will be offered in it, but we can try to gather some information and bring it back.
Summerside Wilmot.
Thank you, Chair. I'd really appreciate it if we could, because I absolutely believe that we need a replacement for the Harborside building. There are literally weeds growing through the floor. It's remarkable. So I'm glad that that's moving forward, but it wouldn't replace the need of another center. So unless this is going to in some way double the capacity, then we're still going to be left with way too many people who don't have access to medical services. Any information you could bring back on that would be really appreciated. That'll be fine.
Okay.
Thank you, Chair.
Mermaid Stratford.
Mr. Chair, as part of the strategic plan for Health PEI, they indicate the establishment of psychiatric urgent care at QEH. And my understanding is that will be a build on to the QEH. Is that accurate?
Yeah, that's correct.
Okay. And when is that supposed to start?
In the last section.
What's in that one?
Number 3.
Number 3?
It actually was in bullet number 3 of the health and wellness section.
Thank you. Okay.
Member Stratford?
Thanks, Chair. So how will this mental health and addiction emergency department at QEH work with the new Hillsborough Hospital? Will there not be emergency room services at the new hospital?
That's not something I have an answer for right now, but we'll bring back what we can find out about it.
Mermaid Stratford?
Okay, thank you for that. As well, in their strategic plan, they identify the implementation of the Mental Health and Addictions Capital Redevelopment Project. Is that the mental health campus that they were referring to when they say Mental Health and Addictions Capital Redevelopment Project? And if so, can that be tabled?
I would assume that that's what it is. Again, I don't have that in front of me, but we'll bring back what we can.
Okay.
Mermaid Stratford?
I think I'm good for now, Chair. Thanks.
Any other questions on this section? Time value, sure.
Here, I just want to, just make a little comment here, just listening to the discussion. You know, as we look over these items listed here, you know, like most of them, in fact, almost all of them, I know exactly what you're talking about, or I have a pretty good idea. So like partial roof repair at KCMH. I understand what a roof is, and I understand like what KCMH is, like I get that. You know, pretty much every example is the same, like I get that. But when we're talking about these medical homes, like we're having a discussion about something that we just don't even, I'm pretty sure everybody sitting here has a slightly different envisioning of what that is at this point, because we've had so many different you know, descriptions of this from the minister and the premier, and no real clear information about what they are. And I'm listening, you know, to the questions from Summerside Wilmot, and they're great questions, just basic, like, so what is this going to, the center, the medical home in Summerside, like what will it involve? Like what will happen there? And we can't answer those questions. So it's just, I realize that this is the capital budget. I have no idea how to approve something when I don't even know what it is. And that's just incredibly challenging. And I'm sure you won't have an answer to that, but I did really feel like I needed to highlight it. And we've been told that that information is going to be provided in November, and I just find it really hard to believe that there was no way to get the information about, you know, what this roadmap to primary care is actually all about, and what will be actually happening in these medical homes, what they actually will involve before we're having this discussion. We're talking about a few weeks difference, because right now, none of us in this room really know what that is, and that's a problem. That's all. Thank you, Chair.
You're welcome. Mermaid Stratford?
Thank you, Chair. And I'll just add on to that. I mean, we've heard two ministers in the say, you want to come have a briefing with me, come have a briefing with me. That would be great. I invite y'all to come have a briefing with me. I'm going to point out it would have been great to have a briefing before we got to the capital budget so that we could actually ask the questions. Throwing out, come have a briefing with me when we have a document on our desks and, you know, have been asking all week for backup information, which thankfully came today. That's underwhelming. And frankly, it's a poor answer to a question, because if you have that information, the briefing should have been provided well before the capital budget coming out and everything being solidified. So I'll just kind of pile on a little bit, because that would have been a really good invite to have prior to us having to make a decision on $211 million.
Thank you, Honourable Member. I can just bring forward what I've got in front of me, and we can reach out to the department to see what they're willing to bring.
Thank you.
Thank you. Montague Kilmuir?
Thank you, Chair. This is where the new KCMH, would that fall under this section? Can you just, I guess, go over what the initial $750,000 will be spent on?
Go ahead, Gordon.
Or what that process is?
Sure. At the start, in particular in healthcare services, they kind of would begin to develop a master plan and a functional plan for what health services need to be provided to the residents of a particular area that will be served by a particular building. So the initial $750,000 is to carry out that study. It's like a needs assessment for healthcare for the area for the long term.
Montague Kilmuir.
And would the public be involved in that?
That's a good question. I don't recall whether there's public input on that. I suspect so, but I'll have to bring that back to make sure.
Montague Kilmuir.
And I know there is the questions already started, of course, on if we get a new hospital in the Three Rivers area, will that affect the services offered in Surrey? And they want to be sure that they don't lose any of their services there. Will they lose any of their services?
Honourable Member, I would assume not. Again, that's not a discussion that I've had, but we know the importance of providing, a medical services in the Three Rivers area, and there is already a hospital in Surrey, and I would suggest that we would keep that hospital.
Montague Kilmuir.
And now I know in the budget that we have the initial money to do this master plan, and that's excellent, and finally a commitment to build a new hospital, which is amazing. Everyone's quite ecstatic in my district, and I'd say the surrounding districts. But I know that the questions that'll be coming probably in the next year or so will be, do we have to wait so long to finally get to the stage where we're actually starting to build the hospital? I know something like this process doesn't just happen in 2-3 years. It takes time. You have to plan it, design it, build it. But anyways, I guess just hopefully maybe in a couple of years' time, or as we keep getting new capital budgets every year, if that can ever be sped up a little bit, because it is in very dire shape, and I know those questions will come, so.
Yeah, Honourable Member, we're very cognizant of the number of commitments we've made over the 5-year plan, so we want to ensure that we can get those to completion and before we start taking on new projects, and that's why it is pushed out further, but cognizant of the amount of money that we are spending and the amount we're applying to our debt, so.
Morel Dona.
Thank you, Chair, and thank you, Minister. I've been paying attention to the debate here. So this handout talks about medical homes in Alberton, Summerside, Queens, and East. So from what I understand, medical homes are not just one facility, but you had made reference to the East medical home being in Three Rivers, and I don't feel that's exactly what's going on. Do you have any more information about that?
I do not. I do not have an actual location. That's just what has been provided to us. And we look at both medical homes and neighborhoods, and whether the actual home then has satellites throughout the outlying communities. And that's a question that I have as well, because both regions of my district are concerned about not having some kind of medical service in the area. So I'm looking forward to seeing the satellite locations and the satellite services that can be provided through the medical home with medical neighborhoods. So.
Morel Dona.
Thank you, Chair. But I did hear you say Three Rivers for this. So. I really don't think that's what's going on. I think, I don't want necessarily demanding just, health services for Morel or something like that, right? I want to be part of the solution for Eastern PEI. And I understand there will be, I'm assuming that they have to do something with the new hospital in Montague. I think it was announced with the medical school, but training and that kind of stuff too. But I don't think that's where a medical home is going. For example, we've been pushing for a long time in our area to consolidate our medical services and to be a heavy part of the new medical home. We talk about all the time about, if we're going to drive from St. Peter's or Manstoward to Somers Else, they can easily travel there as well. We provide a lot of services there, especially with the lack of clinic in Eastern PEI, especially with the lack of nurse practitioner time. So these are one of the things that we've been pushing for a very long time. So when health is coming to you with this plan and there's going to be design commenced in January 2022, that's pretty quick. So when will we expect it to know the layout or the plan, I guess, for that?
That's not something that I have in front of me, Honourable Member, but I'll be happy to bring it back. And if Three Rivers or Montague was mentioned, maybe we misspoke on that, because we really do not have any idea where it's going to go.
Morel Dona?
Thank you, Chair. So, what do you suggest I do and our community does? Because we've been working with the Department of Health on this for some time. How do we get that front and center in this capital budget? Because it's happening, I mean, the planning is happening now for January.
Honourable Member, have a discussion with the Minister and bring your concerns forward to him.
Morel Dona?
Thank you, Chair. I guess it goes back to that plan. I think that's going to be released in November from the department. I'm good for now. Thank you.
Charlottetown Winslow?
Thank you, Chair. My line of questioning kind of followed in line with a little bit with Charlottetown West Royalty. So on the handout that you provided, it says the Queen's $24.4 million for the new government-owned site, plus the leasehold improvements to the existing. Those existing sites, do we know what they are?
What they are, where they are, the same we promised.
Yeah, Honourable Member, we will bring that back.
Okay,
More
perfect.
detail.
Charlottetown Winslow?
Nope, that's fine, thank you.
Okay, I have to share the same concerns too with just the W's, for instance, of, you know, and I've been asking questions on this too, and it's really frustrating and concerning that I have to make a decision to support, you know, in this particular area, $54 million on something that we really don't know about. So I just wanted to put that on there. I do have many questions about these, medical homes and neighborhoods and how it's going to affect the collaborative center that's already in existence in my town. So that's very concerning. So I do share the frustration with the other members. Pardon? Yeah. So, and I know in past questioning, it was told that it would only be enhanced services provided to my community, in my community, but I still don't have the particulars on that. So I just wanted to share that I do have that frustration. Are there any other questions on this section? Mermaid Stratford?
Thank you, Chair. So yeah, I'm going to go there too, because I mean, there's a new clinic that's opened up in Kinloch Crossings, and there's 6 excellent physicians that have come together because they wanted to work in a collaborative practice, and I believe that actually there's 5 of them. There was 10 physicians that had put their names forward that wanted to work in a collaborative practice. One of which opened in Charlottetown, one of which is the one where my physician is in Kinloch Crossing. And so I am under the assumption that these medical homes are not going to impact the current facilities and clinics that we have in our communities today. Can you confirm that for me 100% right now, that our communities are not going to be losing what services they have today instead in favor of these homes?
Well, Honourable Member, not being the Minister of Health, I can't 100% confirm that, but in my own mind, I've got questions too for my own district. But the way that medicine is moving is a collaborative model across the country, really. And I think each clinic that is opened, the doctors within that are going to work in a collaborative way. But again, I'm the Minister of Finance, I'm not the Minister of Health. But we've already promised to bring back whatever we can regarding the medical homes and neighborhoods.
Mermaid Stratford?
Thank you, Chair. So I have just been filled with a whole lot of uncertainty right now. No, just one second. And I'm going to ask for an intervention from the Minister of Health because I want a commitment.
You can ask, but the minister would have to ask for that intervention himself.
Yep, I understand that. So I'm asking for an intervention because I would like commitment from the minister today that services that exist in all of our districts are not going to be eroded because of the plan for the new medical homes, and that they are all net new, not taking away from what we already have.
Okay, intervention from the Minister of Health and Wellness.
There's two things here I think that we have to keep in mind. First of all, this is the capital budget, and just bear with me, please, just for a minute. But it is the capital budget, and this is to provide the infrastructure, the physical infrastructure that we need for whether it's our hospitals, acute care, such as Kings County Memorial, or whether it's for our collaborative practices, medical homes, that base. So we do need that physical infrastructure, which is what's covered off here in the capital budget. With regard to the members' comments, I see medical homes not eroding anything, but building upon what's there. But now, having said that, I think that we all know that any healthcare worker at any point in time, for whatever reason, can move on to a different location, to a different area of the country for that matter. But certainly I assure 100% to the member and to the legislature here that the movement to medical homes, medical neighborhoods is in no way to erode any of the services that are provided in areas right now.
Thank you, Minister. Member Stratford.
Thank you, Chair. And thank you, Minister, for the intervention, because I think that all of us would be taken by surprise if we voted for this budget and realized that at the end of the day, what's in this budget is going to impact our communities and our districts in an adverse way. And I'm going to let the minister give another, he's waving, so.
Okay. Intervention from the Minister of Health and Wellness.
I certainly appreciate that because, you know, sitting here as the Minister of Health and Wellness, but also sitting in this legislature as a representative of District 26, Albert and Bloomfield, which does have the westernmost acute care facility. Now, just bear with me, please. I appreciate exactly where you're coming from. I want to see those services not only maintained, but I want to see them improved. So I just wanted to make that comment, Chair, and that certainly do appreciate where all of the members are coming from here, yourself included, Chair. So thank you.
Thank you. Member Stratford.
Okay, and thank you for that, because, I mean, this is really what comes down to when we are making decisions that impact the people, especially in our districts, but Islanders as a whole, and when we don't have all of the information. I mean, I will go back to a briefing on what you proposed from your department and what Health PEI proposed to put into this capital budget should have come well in advance of this capital budget being presented in this legislature. Because when we are making decisions for our, and I understand you said a physician can go anywhere. Like, we have a major issue with retention. I understand that. A physician can go anywhere, but my expectation is that we would try to recruit to replace them instead of them just going somewhere else and us saying, that's okay, we've got a medical home 20 kilometers away. They're going to be fine. We'll absorb that because we're going to say X number of patients can be managed out of a medical home, which we don't even know that, because we don't even know how many patients physicians actually have on their patient registry, right? Like how many they actually take on their patient list. And so this is one thing that I find all the time with Health PEI is there's a lack of data that is accessible to us so that we can come in here and make really incredibly important decisions about the lives of the residents that live in our districts. And so if you can assure me 100% that the services that are available in my district will be remaining in my district, and that you will try to recruit if somebody leaves, and that it's not eroding or taking away from the services in my district, I think that's what everybody in here is concerned about when they make that decision. Then that gives me a little bit more comfort, but whew, was I ever getting the wrong feel of where this conversation was going this afternoon? And I really need to have full assurance before I vote for something that I'm not hurting my residents.
Time Valley Sherbrooke.
Thanks, Chair. No, I really appreciate comments from Mermaid Stratford there, and I want to point out though that whenever we're in a situation where we're having these incredibly important discussions about making sure we're responsibly spending taxpayers' dollars, if a conversation comes down to just trust us, which is really where we're at right now, right? We don't know what the medical homes are. That is not okay. Like, I think it would actually be really interesting if we all could take a minute and draw a picture of what we're envisioning these medical homes are right now, and then share them, because I am most certain they would all be different. I'm uncomfortable with how this is all developing, and I just want to point that out. And I ask in the future, should you be bringing anything forward that results in a requirement of us to just trust you, that's not okay. So, thank you. That's it.
Thank you. Any further questions on this? Shall the section carry? Total capital expenditure health. Pardon me? No. Okay, so I'm going to ask. Okay, I'm going to ask. Then it's the pleasure of the committee. Right, I'm going to take a vote on it, whether this section carries. All those in favor of this section, capital improvements, carrying, please raise your hand. 1, 2. All those not in favor of carrying this section until the information requested comes back, please raise your hand. Okay, so honorable members, we will not carry this section, and we will move forward to another department. And we will come back to this when the requested information is acquired.
It's like real time.
Okay, we're moving on to page 21, capital expenditure, justice and public safety. Equipment appropriations provided for the purchase of equipment, 911 system upgrades, 300,000, provincial integrated communication system, 75,000, vital statistics, 33,000, core technology, 135,000, total equipment, 543,000. Any questions? Shall the section carry? Capital improvements, appropriations provided for capital improvements, 2 properties. Correctional Center improvements, 235,000. Correctional Center Women's Unit, 2,650,000. Building improvements, 100,000. Total capital improvements, 2,985,000. Summerside Wilmot.
Chair, I was just wondering what the difference between this budget line and the building improvement line is.
Sorry, I didn't catch that.
I was just wondering the difference between this budget line and the building improvement line in this section. I guess I don't understand the difference.
If you just refer to a couple of numbers, so I know which ones you're kind of. So like the building improvements section has a small budget for repairs at the PEI Youth Center, and the correctional center is the balance of it. For that's the construction program that's going on at Sleepy Hollow for the women's unit there. And then there's a further amount for general upgrades and improvements at the correctional center for the other spaces.
Summerside Wilmot.
Thank you, Chair. On the correctional center, can we get an update on this project for the women's center?
It is nearing completion. I believe it will be operational in the winter, pick a month, but before the end of the fiscal year.
Summerside Wilmot.
Thank you, Chair. Was this project not originally slated to be done in 2022? Are you saying it will be done by the end of this fiscal year?
What I'm suggesting is that there is some money in the 22-23 fiscal year to finalize the construction. So maybe this summer. I'll have to keep flipping here to find a date for you for when it's supposed to be operational. But the fact that there's $2 million, $2.65 million available for that particular project would indicate the last piece of the construction is kind of going into April and beyond.
Somerset Wilmot.
Thank you, Chair. What is the plan for the female inmates at Sleepy Hollow until that construction is complete?
I think they're being housed in Summerside right now.
Somerset Wilmot.
Thank you, Chair. I was wondering if you could explain why the forecast for this fiscal year is nearly 5 times what was budgeted. Oh, I'm on the next line. Apologies. I'm good for this section.
Okay. Any other questions in this section? Actually, so capital improvements, any other sections? Any other questions? So I'm on the page 21, capital improvements. Yeah. Okay, Summerside Wilmot.
Thank you, Chair. I clearly need another cup of coffee. I am curious if we are doing anything in the building improvements to be building to net zero. I'm just aware that the minister has a plan to reach net zero by 2040, and retrofitting buildings is like 3 times more expensive than doing the build at the time, so I'm just curious if that's part of it.
I can't confirm that for sure, but I will bring it back. I'm assuming it would be because, that's the goal that we've had for moving forward, so, yeah.
Summerside Wilmot.
Thank you, Chair. There's been a push in the justice world towards restorative justice and rehabilitation projects. I'm sure you're well aware of this. I'm just aware that the consequences of this means that it can reduce the need for jails, but it does mean that we need more we might need different options for supporting people moving forward. And I know the Minister of Justice is particularly passionate about seeing more restorative justice projects moving forward. Do you have any sense on how that's going to impact building projects moving forward for this department?
It's not something that's come to the, I'm aware of the issue, but there has been no discussion with the Department of Finance about how we move that forward. But again, discussion we can have.
Summerside Wilmot.
Thank you, Chair. I think I'm good for here.
Any further questions in this section? Shall it carry? Total capital expenditure, justice and public safety, 3 million, pardon me? Okay. Okay, no, I didn't. Sure.
So, what's the breakdown in the renovations to more of the correctional facilities for improvement? The $250,000. What facility is it?
It would be a general budget available to the department to upgrade all their buildings. I do note that there is a dedicated $100,000 for the youth center, but so if there were repairs required at the, let's say the jail in Summerside, this would go there. At the Sleepy Hollow, so it's a general fund.
Okay.
Leader of the third party.
Do all the provincial facilities have mechanical ventilation systems in place?
We don't have that on us, but we'll bring it back.
Okay.
Leader of the third party.
That's good, thanks.
Okay, shall the section carry? Total capital expenditure, justice and public safety, 3,528,000. Shall it carry? Capital expenditure, page 23, social development and housing, equipment. Appropriations provided for the purchase of equipment, child protection technology, $276,100. Total equipment, $276,100. Mermaid Stratford.
Thanks, Chair. Do you have handouts for this section?
Not yet. You're going a little faster than I read anticipated today.
We went faster there. See, that's what happens when we get handouts.
Okay, Minister, are there handouts for this particular?
Not yet.
Okay.
There will be.
Okay. So I have another person on the list. Do you want me to come back, or do you want to continue with another question?
Nope, you can go on, yeah.
Okay. Charlottetown Victoria Park.
Thank you, Chair. I'm just wondering if you can explain this child protection technology.
So the few brief notes I do have is that it's actually a software that's used by social workers. to assist them, I guess, in the decision-making of the child protection services. So it was come off a report under a review, the Child Protection Act review, and there were 66 recommendations, and it highlighted the need for consistent, comprehensive, evidence-based decision-making, and this software would be part of the case management system that would kind of record information to allow them to kind of make better decisions.
Charlottetown Victoria Park.
Thank you, Chair. I think that's good for this section.
Okay, Charlottetown Belvedere.
Thank you, Chair. So I recognise this is in social development and housing, but if there's child protection technology, is this specifically for CPS only, or is this being done in conjunction with the Child and Youth Advocate's Office?
The hour has been called.
All good, all good. Mr. Chair, I move the Speaker take the chair and the chair report progress and beg leave to sit again.
Carry.
I can't sleep in.
Mr. Speaker, as Chair of the Committee of the Whole House having under consideration the grant of capital supplied to Her Majesty, I beg leave to report that the committee has made some progress and begs leave to sit again. I move the report of the committee be adopted.
Shall it carry? The honourable member from Morel Donagh and a government House Leader.
Thank you, Mr. Speaker. Mr. Speaker, I move, seconded by the member from Montague Kilmere, that this House adjourn until Tuesday, November 2nd at 1 o'clock in the PM.
Ooh. Shall it carry?
Carry.
Have a good weekend.